See the blazing hill before us. Strike the harp and
This live stream is brought to you by B-Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. See the blazing hill before us. Strike the harp and
This live stream is brought to you by B-Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel.
Huh? No, she came in and asked me, and I just made some copies for people. She asked me if I didn't follow the master warning. Oh, we've been kind of, so I can find this out.
The 20th, they will. That's over here.
And it's helpful.
So,
What they're
anyways,
saying,
so I asked if that was going to be on my record
that's under Title 50.
as a misdemeanor or
This live stream is brought to you by B-Red Chamber of Commerce and Agriculture.
Deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. See the blazing hill before us. Strike the harp and
This live stream is brought to you by B-Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. See the blazing hill before us. Strike the harp and
This live stream is brought to you by B-Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. See the blazing hill before us. Strike the harp and
This live stream is brought to you by B Red Chamber of Commerce and Agriculture.
Deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. See the blazing Yule before us. Strike the harp and
This live stream is brought to you by B Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. Fa la 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 la, fa la 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 la, fa la la. See the blazing Yule before us. Strike the harp and
This live stream is brought to you by B Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. Fa la 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 la, fa la 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 la, fa la la. See the blazing Yule before us. Strike the harp and
This live stream is brought to you by B Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. Fa la 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 la, fa la 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 la, fa la la. See the blazing Yule before us. Strike the harp and
This live stream is brought to you by B Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright apparel. Join the ancient Yuletide carol. Fa la 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 la, fa la 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 la, fa la la. See the blazing Yule before us. Strike the harp and
This live stream is brought to you by B Red Chamber of Commerce and Agriculture.
deck the halls with boughs of holly. 'Tis the season to be jolly. Don we now our bright Riverside carol. Fa la 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 la, fa la 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 la, fa la la.
Need a protein.
You can tell everybody who's watching the Zoom meeting.
Yeah.
But I can only do that.
Before we start, can everybody on Zoom hear us?
Yep.
Okay. I'll take it that everybody can. So,
Come on in.
okay, I'll start the regular meeting of the City Council for November 18th, 2020 at 7 p.m. Todd, lead us in the pledge.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You gotta make sure to slam that door.
Yeah, you go slam it.
I'm not sure if slamming it sometimes works.
Just pick up on it a little bit.
Okay.
Here we go.
Mr. Mayor?
Yes. Okay. I can hear when you asked for me. You mumbled some there.
I didn't hear what you said.
I didn't hear a word.
Can you say that again?
Okay, first item on the agenda is minutes.
Move to approve. Second.
Moved by Bill, seconded by Dan. Discussion.
Call for the question.
Question's been called for to approve the November 4th, 2020 regular meeting minutes of the City Council. All those in favor say aye.
Aye.
All those opposed say nay. I take that as unanimous. Okay, I have no petitions, communications. So, right after that, we'll jump right into probably what everybody's here for. And that is the discussion for the city role and the city county health board and any, just the emergency declaration or whatever for COVID in general discussion. Kind of going to leave it up and open. I was thinking when I did this to be more for businesses, but if people wanted to comment personally, it's fine. We're trying to respond to what Mr. Warner brought up the time before, and we wanted to put it on the agenda for discussion, and that's what we're here now, is public discussion. for it.
Mr. Mayor,
Yes.
I have some discussion because this is concerning the COVID virus and things that we do as a city to try and deal with that virus. I have invited several colleagues from the hospital to come tonight and give comment, and I'd like to open that for these people on Zoom. Dr. Logie, would you like to start?
Start on what? Just,
Making comment.
now, we'll let the council make comment first, then we will go to the public.
Mr. Mayor, would you please explain to me what you want council to do with this, first of all? So we're not all just spinning our wheels here. Let's get the direction we need to go.
First thing is, I handed out all the minutes for this meeting, for the city council meetings from this year.
Yeah.
And so unless there's questions on that, we'll move to the next. The next part mainly is just general COVID discussion, but I would like at the end of the whole meeting, if possible, the council to give me the authority that if it turns out the city county health board is not working in the direction that the city wants to go, then I would have the authority to remove ourselves from the city county health board.
Why is this not passed off to the Health and Welfare Committee for initial review before it comes to the council with a recommendation?
Well, the main reason for that was mainly it was brought up with George Warner and started and was going to be put onto the agenda on discussion of COVID. And that's pretty much the only reason.
Okay, because at the meeting when Mr. Warner presented last time, he said he didn't want any action from us. That's why I'm a little confused why this topic's on here like this.
Okay? And we can put it back next meeting if you want after we get comment from everybody.
Well, I'm certainly willing to listen to comment, no doubt about it. I just think the committee ought to hear it first, that's all.
Yeah. And it's possible, thing was, is the meeting, I was told to put this on this meeting. Health and Welfare is meeting tomorrow.
It is.
And then we wouldn't have a chance to even discuss anything until the next meeting after that. The second one or first one in December, December 2nd. And then at that point, you can make whatever decision. If that's what you want to do, we can do that. I can't push it to Health and Welfare because that's already been released.
Mr. Mayor,
Yes?
since this is gonna be a shoot at the OK Corral, and other people have come here for the meeting, I would suggest that we go ahead and conclude this party. However, I do want to say that I spoke with the CEO, of Barrett Hospital this morning, Ken Westman, and he was not aware of what had proceeded, and he was not aware of the agenda item in terms of tonight's meeting. So I assume that the other parties, including Dr. Logie, are perfectly able to pick up the ball. But I think a better job could have been done in terms of alerting in fairness, the medical community, since they're going to be affected by it, so that they could comment.
And actually, my position on the whole thing was the medical profession might be affected some by it. The biggest part that affected is the business owners by the rules that's being changed. That is why I'm trying to push it away a little faster, because the governor just came with a change, just like another Democrat's always been doing. And so that's why I moved it forward faster. But if you want, we can slow her down.
Mr. Mayor,
Yeah.
I'm neither a Democrat or a Republican, but I take offense at that last comment. Other Republican governors have also issued similar orders, and I believe it's inappropriate to make this a political battle.
Okay, thank you for your opinion.
Okay.
Now,
Is the floor open yet?
not yet, just a second.
So we're still talking on this first part here.
Well, that's just if you guys had any questions on this.
I guess I do have a question on that. The last one seems to have been dated July 31st, 2020. Is that indeed the last Beaverhead County City Health Board meeting?
Well, we had another one after that. It was in August, but we have not had another meeting after that to approve those minutes.
Okay, so
So all the
August,
meetings-
so there was one in August that do not appear in.
And I can't remember the exact time in August.
Okay,
I could have put it in, but it wasn't approved by the
Okay.
board, so.
I have the date on that. It's August 21st, and I have the minutes if you need it.
Okay,
okay.
21st.
And so per the last city council meeting, that would indicate that according to the last bylaws that we had seen, there should be a meeting this month because they're supposed to meet every 3 months, correct?
And there's one scheduled to be done on the 23rd, this Monday,
Okay.
at 10:30, if anybody wanted to come to it.
Okay.
And that's another reason we're trying to get it done tonight, is I put this on the agenda Monday And then Tuesday sent out saying they're gonna have a city county health board meeting on Monday. Okay, so, and in that, discussions have been done that they wanted to increase the enforcement. So go beyond what the governor has been set. And, or at least put more weight for the local people to enforce it with what the governor has done. So that was another reason. That was going to be discussed on the 23rd, Monday.
Mr. Mayor, so are we, I'm going by the agenda, and so are we to the point where we are going to discuss, I'm reading right from the agenda, discuss, approve, or deny the city role in the City County Health Board and the COVID-19 emergency declaration in general.
Yeah.
Okay, I do have some comments. I'm very
Before we get into
troubled.
comments, Mary Jo, I'd like the council to address this first before we start doing public comments.
I am on the council and I am making my comments. Thank you, Mr.
Okay, if
Mayor.
you're gonna do it as a council person, that's fine, but let's not do the public ones yet. That's what I'm
I'm not doing it as public, I'm doing it as a council member.
saying. Very good, please proceed.
Thank you. I am very concerned and disturbed by this whole process that we've gotten to this point. But I don't want to get caught up in the minutia of that kind of a deal. I want to talk about what are the consequences for the people and for the businesses of Dillon if either of these two proposals are approved tonight. I want to make sure that with my mask you can understand me. Thank you. Yeah, Matt, just smile. I'm very, very worried that there will be, if we stop dealing with this virus, with the best practices that are outlined by those professionals working in the field, we could unknowingly prolong this pandemic. If we stop dealing with this virus with the data-driven best practices as outlined by those professionals working in the field, we could unknowingly extend the hardship, the economic hardship suffered by the people in Dillon and our local businesses. If we stop dealing with the virus by withdrawing from the City County Health Board, we risk losing funding for emergency needs such as those purchased by the County Public Health Director with the $50,000+ grant she received. Those funds were used to hire contact tracers, buy mobile refrigeration units for vaccines, and pay overtime expenses. If we stop dealing with this virus by withdrawing from the City County Health Board, we risk losing funding for vaccines, the costs that go into distributing those vaccines in this huge geographic county. If we stop dealing with this virus by ending the emergency public health declaration, we risk losing access to coronavirus packages such as the PPP and the CARES Act and the Small Business Relief Act and the Education Relief Act. I think this is a proposal that is put on the table, and we don't know all the consequences. Before we even consider this proposal, I hope that we ask for input from our healthcare professionals, from our businesses downtown, and from and these are just a few of the agencies I spoke to today where there are serious consequences for Dillon, our police department, our emergency medical services, and those would be from the Department of Administration, the Department of Revenue, the Department of Public Health and Human Services. The Commerce Department has given several $1 million to businesses in Dillon, and there are several grants that have been given to UNW through the Commissioner of Higher Education's office, Department of Public Instruction, Small Business Administration, and these consequences just go on and on and on. And before we make this kind of a decision, I hope that we will stop, slow down, and get information that talks about what are the benefits of passing these proposals, and what are the consequences of passing these proposals. Thank you.
Thank you, and I agree on determining. I was hoping to get a lot of that done tonight, listening to the business people here, listening to people online. I'm not really sure where you're getting the facts that we're going to lose everything and the whole city of Dillon's going to shut down if we decide not to be part of the city-county health board. At any time, the city council can get together and decide we're going to create our own health board, and then all that stuff would come back again. So if we wanted to do it, I don't really know where you're getting the facts that we're going to lose everything. Who was the one that told you that? Or how did you determine those facts?
Oh, it was not a short phone call to the state today. It was a longer phone call.
And who did you talk to?
The name.
The name is what I'm asking. Who did you talk to in the
I
state?
talked to several different people. I talked
Okay,
to the Department of Revenue.
Who's in the
Never
Department of
mind.
Revenue? Who's in the, no, tell me the name before you say anything. Tell me,
Are
tell me
you-
the name. I'm asking for a name.
I can't remember his name.
Okay, so I can't take anything you said as truth.
I am asking that we solicit information from the Department of Revenue, from the Department of Commerce, from the Department of Administration,
And I really don't
before.
know why we're asking for those things, but, because I have not seen it typed in on any of that, but we're going to solicit from everybody.
Are you, are you saying that there are no financial consequences to passing these proposals?
Not, there could be financial, it could be also benefits.
So maybe I can ask the question in a different way. Do you have a dollar figure?
No.
Do you have any type of allotted money that goes to the city of Dillon, as the city of Dillon sits on the board of the city county health and the grants that they get? Is there anywhere we can look that you indicated earlier on that states if we step out of this, we're going to lose this money? But the city of Dillon, falling within the county of Beaverhead County, gets that money in the form of a grant or whatever. Can you illustrate, or can some of the people that you've asked to speak educate me so that I can understand, yeah, if you step out of this, you lose $50,000, or you lose $100,000, or you lose $2 million that the city is allotted and uses on a regular basis to fight not just COVID-19, but any other health pandemic that might come our way. Is there something that somebody can share with me tonight that I can go, oh, maybe I don't want to step out of this, but as I understand things, If the county is getting money, whether it be from the federal government, from grants, from private grants, from whatever, to help with certain things, the city of Dillon resides within Beaverhead County. And so therefore, city of Dillon should have access to some of that money. Yes or no?
I have no idea. I'm a city person. I sit on the city council. What I'm asking the council to do is that before that you approve either of these proposals, you solicit comment from the state, and most especially, there are two sites, the Small Business Administration site and the Headwaters resource site, and it will give you, both of those sites list by county the different businesses, private businesses that have received both PPP and CARES grant money. And so there's a site that you can go to and you can look at the number of small businesses and individuals that have received money.
But let me interrupt you for a minute. Do those small businesses only receive that type of funding simply because the city council in the city of Dillon is on the city-county public health board? Or are they not eligible for those regardless whether or not the city is part of Beaverhead County Health?
My understanding, and it was, I have to tell you, my education today was quick, very, very quick. But my understanding is that there is a means test when you're applying for those grant monies. And part of that means test is, do you reside in a county that has an emergency declaration? That is one of the tests.
But that doesn't have anything to do with the city. That would be the county.
Oh, do you reside in a city and a county?
Okay, all right, so if you say it that way,
Yeah.
now it does change.
Yeah.
Okay.
But we do have a emergency
And we do.
declaration.
But go ahead.
And I'm not asking to remove that right now.
Right.
They're on each.
Could you clarify
On
that
each
comment,
program,
Mr.
on each program, there are different means tests. That's why I think we need to understand the consequences from each department. I think the police chief is here tonight, and he could probably speak to the means testing that his department went through when they were applying for money.
And actually, I was the one that applied for the money. I signed the document. I got the money. And nowhere did I have to say I'm part of the public health board.
Mr. Mayor, you
Yeah.
made a comment I was unclear on. Could you please clarify it? You said you don't want to end that, I believe, was
There
your
was-
statement now.
There was an emergency declaration. I first signed one, I'm trying to think, it was in March. And I started it. Within a month of that, we sent it to the council. I think it was in April or end of March, some time frame. I can't tell you right now in my memory. I'd have to dig it up. But the council voted on an emergency declaration sometime in March or April. And I'm not asking for that to be removed.
Mr. Mayor,
Yes.
may I read to you from your latest epistle titled Information Collected by Mayor Blackman on COVID-19. Bear with me. Your third to last sentence.
On what page?
Quote, I
What
would
page?
urge the city council to take a position
Last page.
to officially end the emergency in Dillon. The sentence continues, but I will end the quote there.
Or withdraw from the city county health board at the least. And that's what I'm asking right now.
But you stated that you wish the city council to take a position to officially end the emergency in Dillon.
Yep. And I'm not asking
Which
for
is
that.
it? Which is it?
I have already answered that if you would listen. I said withdraw from the city county health board at the least. And that's what I'm asking for tonight.
But it's a two-part statement. You asked for
And
the
if you would listen,
to be rescinded.
and if you would listen, I said withdraw.
Of the city from the county health board. Those are two separate things, but you asked for both of them.
And I withdrew one tonight and I'm asking for the other. I'm not really sure how you're so confused right now on this. But,
Because I
okay.
read your statement, that's what's confusing. And you state now that you don't want us to end the public health emergency.
I'm not sure how you want me to answer what I've just answered several times.
No, I needed the clarification and it's just not forthcoming.
I just clarified it. I'm withdrawing the one and the other one, I'm wanting it to be done.
Ah, okay, you're withdrawing the request for the...
Have I not said that already
of the
3 other
emergency
times?
declaration.
Okay. Thank you. Any other?
Do I understand you correctly that you're withdrawing that?
For this time, I am, yes.
Okay.
Mr. Mayor, can someone advise me as to what the advantage of the city pulling out is? In a few short sentences, please.
In short sentences, we are going to a city county health board meeting on a Monday, the 23rd. At that time, it's been stated numerous times, I've been listening, that they've been wanting to enforce the mayor or governors even more, maybe make it more strict. I'm against that totally. I don't think that's the right thing to do for the city of Dillon. So if that comes about, I'm just asking for the city council to give me the authority, because in our, you notice from the thing that Mr. Warner handed out, the resolution that created our joint city-county health board, then this, I need council approval to withdraw. That's why I'm asking the council tonight, if that happens at the city-county health board, and I'm gonna argue at the city-county health board not to make it any more stringent, not to do anything more than what the governor has said there. But if they do, I want to say that I can then withdraw, if you would agree to that.
Then let me ask this question. If we choose to withdraw from this organization, does that make us exempt from following any county directives or state directives within the city proper?
I believe so.
What do you believe? You.
I think it's time to do.
He merely said he believes so, and I looked at Mr. Dolan and asked him what he believes. If we as a city and if we as a council choose to step away from the city-county public health board, and the governor or the county chooses to impose certain rules and restrictions on business owners within, are we affected by that or not?
Well, I guess I would say I'd like more time to research the issue. Okay. Giving you an honest answer.
Mr. Mayor, may I comment?
Sure.
Okay, I'd appreciate it if I can do it without interruption. You threw me a curve. First, direct my comments about ending the emergency declaration, but if you're withdrawing that request, then I will move on to the subject of the county health. I also share Council Councilman O'Rourke's concerns as far as the unintended consequences that would pursue in terms of the complicated structure of issues of funding and administration. In addition to that, I believe the exit would have consequences which you certainly don't intend, but one of them would be that residents would be obliged to consider leaving and or not shopping in our community. And doing so, living or shopping elsewhere because they feel safer to live and they feel safer for their families. That would have the absolute opposite effect of, I believe, what your principal concern is, in which I will just summarize as the economy of Dillon. Also, the effect, I think, would be disastrous. You are essentially saying, switch the deck. We're no longer going to use the existing apparatus of dealing with public health issues of the virus and community issues involving the adequacy of our medical and public health support systems, that in the middle of that, we're going to switch the deck and do something else. And I think you would have a backlash because it would be a slap in their face of public health community. Consequences of that would be in terms of individual reactions. But I think staff might go more appreciative or safer for themselves or their families. And in a situation which was described of the public virus high school last week as being essentially critical in the sense that we are having troubles adequately staffing the clinic to handle our needs, especially in the sense of overload on the emergency room department operation and the admitted facilities at the hospital. This is insane. In the middle of a pandemic, you're wanting to do this is simply an expression of your opinions and your ideology. You are not a doctor. You're not a lawyer. I know of your virus opinions, and you're certainly free to have your opinions. Mr. Warner, I know from personal conversations with him, I know of his opinions as far as the virus, and his dislike of what the consequences are in terms of legalities of not only the public joint health board with the county, but otherwise. But he's not a doctor. He's not a lawyer. And to ask the city at this point in time to consider pulling out of one of the effective vehicles that we have of dealing with this crisis. Your primary job as mayor, above all else, is to protect the citizens of Dillon. And I believe you are not doing that job. And I believe this would have disastrous consequences if you continue to pursue this course, Mr. Mayor.
Are we done? I don't want to interrupt you. Are you done? I think he's done. I mean, I don't, any other comments?
I got a few questions or comments here. Let me get this over here, I guess. Number one, I'm glad this is on the agenda because for the last 6 months, I personally, as a councilman, have been trying to get some answers. I've asked the mayor, who's a member of the Beaverhead County City Health Board, and he can't seem to get the answers because the board seems to like to keep everything as hush-hush as they can. I've asked questions about current numbers. How many current numbers do we have today? How many of them are associated with the college? You can't get any of that information. They routinely keep everything 2 weeks behind. Now, I was told today by an unnamed source, by the way, Mary Jo, and I don't know how true it is, but over half the COVID cases we have in today in Beaverhead County is emanating from the college. I don't know if that's true or not. That's roughly 50 some odd cases at the college. I don't know how true that is. I can't find anybody who will give me an answer on it because everything is 2 weeks behind. I think it's kind of amazing that the Beaverhead County Health Board wants to close down restaurants, bars, and places like that in Dillon. We have not, as far as I know, had a proven case of coronavirus being transmitted because of that. But yet we have the college with 50 cases of coronavirus total. We know that's where it's coming from, and not one attempt has been made saying maybe we ought to close down the problem. I think that's kind of an interesting thing. I'm glad to see we have so many people here. I'm glad to see we finally have got the attention of the Beaverhead County Health Board, who at least some of the people I think's on it. I can't tell all the names, I could be wrong. But whether we go ahead with this or not, one thing I'm reading by the bylaws, if we pull out of the Beaverhead County Health Board, that effectively ends the Beaverhead County, Dillon County Health Board. As you read in the thing, if after 30 days, in the event that the City County Health Board is dissolved, which is what's going to happen if the City of Dillon moves the health, leaves the health board, that will dissolve the City County Health Board. Which, and I don't know what all that's going to entitle. And quite frankly, it's not my idea to pull the City of Dillon out of the Beaverhead County Health Board. But I would like to get some answers. I'd like to know questions. I mean, like I said, we've been asking, what's the true numbers? How come we can't get numbers that's more than 2 weeks old? All the numbers we get are close to 2 weeks old on basis on the college. In fact, the high school, I find out more information on the high school from kids that I know that's being sent home in quarantine than I do from their official website. And I think that's terrible. There's the Beaverhead County Health Board, they should be emanating that stuff every day. It should not be, oh, we have 10 cases, but we're not going to tell you where they're at. We should have the right to know if they're emanated from the college. And as the county, or the city attorney, or the city council, excuse me, we should have the right to that information. It should not be secret. And to me, everything they're doing is secret. They purposely hold their meetings in places that most of the public can't attend. They hold them during the daytime when most business people are working, they can't attend. I would like to see the Beaverhead County Health Board start holding the meetings in more public places and in the evening when people can actually attend. I don't know, is there any, and I see we have, I think that's Sue Hanson up there. Does she have the newest numbers on how many's at the college, and can you give them out, or what? How do we get that information?
Sue, I'm happy to speak up if you'd like.
And who are you?
I can give those.
Yeah.
Hi. My name is Kara Richmond. a new disease intervention specialist at the County Public Health Department.
We can't understand you.
So we're monitoring numbers. The numbers get posted daily on the Montana Department of Public Health and Human Services website. If you look at their website, that gets updated every day at noon. We roughly at this moment have about 120 active cases in the county of Beaverhead, and about 22 to 25 of those are from the college.
How many of them have came from bars?
Well, after Halloween, we had quite a big jump in cases, and a lot of people were out on Halloween night.
Okay,
I don't really answer the question.
I know. How
Well,
many came from bars?
For those of us that have been to college, I think we know where college kids congregate.
It's only basing 22. So let me ask you a more important question there. Is it Kiara?
Ms. Richmond?
Miss Richmond, let me ask this. You said there was roughly 122 or 128 cases in Beaverhead County and 22 to 25 somewhere there were in the college. Beaverhead County is a pretty big county. Can you tell me that the remainder of those cases reside here in Dillon? Or are they somewhere else within this county?
We have cases all over the county right now.
It's a big county.
I'm not trying to say the question.
Are they all in Dillon?
Can I interject, please?
Sure.
Okay, so I guess I'm not understanding, we keep totals for the county since that that's what our jurisdiction. What difference does it make where these cases are? We know they're all over. We know the virus is everywhere. So I guess I'm not sure why this conversation is on where these people are. It should be on how we're going to keep our community safe and keep these numbers down.
And maybe one of the parts of the question is, it seems like we're nailing restaurants and bars, but if 0 cases come from restaurants and bars, why are we doing that?
Who said 0 cases were coming from restaurants and bars?
What I've been asking for 3 months. I've been asking for 3 months to get the data on where they're all from. And I still haven't even got the answer yet tonight.
We don't keep track of where every contact has been.
Kind of funny, you keep track of where they work.
Now.
Oh, they do.
Now.
Seriously?
Now, don't. You have your time to speak.
Well, this is taking way entirely too long.
Got any other questions?
I'd like to interject one thing, Mr. Mayor.
Just get a microphone if you could. There's one up there and there's 2 in the
You
back.
got something, Mary Jo?
I do. Mr. Mayor, I started this conversation by relating to my colleagues here on the council that because this issue is so intimately tied to our first responders and our healthcare workers and our health resources, that I invited them to come and give comment. And I'm wanting, before we go in person here, let's see if we can hear from the people who have Zoomed in, because as we know here on the council, this doesn't always last. This has a tendency to disappear. So let's get comment from here.
And I've asked in the City County Health Board meeting, and I will ask for their comments, but I've asked in the City County Health Board meeting, and what I'm getting is nobody really knows how long it'll last. It could be a year and a half to 2 years further to go. Maybe longer, maybe 5. Nobody knows. Unless there's some differences, I believe Dr. Evans was one of them that stated that. Now, nobody knows when the virus is gonna, if it ever will die out. And that's all I've been reporting in here, no matter what people think that I am. I was called some, I don't know, stupid or something like that, or not knowledgeable, but I went there and I did a lot of research, stuff that could be done by anybody in this room. They can read through any of the scientific journals is what I've done. And what we're doing is not what shows to be done. And
I thought we were
claiming
talking
to do-
about the agenda item.
And you've made statements that there's only certain groups up there that's knowledgeable on this subject.
I believe that we
Mr.
have
Mayor?
professionals.
You've had your chance to talk. Now let's let other people talk.
I get as much chance as everybody else.
Point of order, Mr. Mayor.
Point of order.
So Fitz,
No point of order, Mary Jo.
you introduced the subject of your
Mute him right
study.
now.
I would like to talk about your study.
That's not fair.
Okay, now Mary Jo, speak.
I again ask that
Okay.
we go back to the beginning and we receive comment from,
Okay, which one wants to do it first?
Point of order, Mr. Mayor. I was
George got up
recognized by
first.
the chair.
Flip the microphone on.
Where's the switch?
In the back.
back, way back.
It should turn red when it's on.
Did you get it?
I think so.
Okay, George Warner.
I introduced my, my
I'm
people before you
speaking.
were.
No, Mary Jo, I
This is a
have
point of order.
The mayor
I was
actually
first.
the meeting, not the council people.
Let him do it, then we'll go back to your guys.
The comment was specifically to redress Mr. Wassel. He stated that he knew some things, and he doesn't know some things because he wasn't here last week. And I don't know how inclusive the minutes were, but there's some specifics. Mr. Mayor, you or I are not doctors. That is true.
I didn't state.
But we have both been executives. And by statute, he is and I was the health officer of the city. You say it's none of his business. It is his business. That's his duty. He was elected for that. And for you to believe that he doesn't have the statutory authority to deal with the health implications of the city of Dillon shows that you haven't researched your ordinances or your statutes. That has been part of the initial problem that I've had with this entire process is the city county health board had the obligation to include him as his position is mayor. He is the health officer of the city of Dillon. You can't change that. It's always been that way, and until the legislature changes it, it will remain that way. That's all I have to say.
Mr. Mayor, the comment is directed to me. May I respond?
Keep it to 2 minutes.
I'll keep it to whatever time it takes, Mr.
And I'll meet you again if you don't.
Well, if you do, then I'll file a complaint with the state authorities for government.
Fine, and we'll see you then. You can respond, I said respond.
Okay. Mr. Warner, evidently you weren't listening. I told Mr. Mayor that his first responsibility to the citizens of Dillon was to assure their safety. Obviously, that includes public health. So to claim that I'm disputing his, quote, statutory authority as the chief public health officer I believe that was your statement, of Dillon is not what I stated.
Okay, thank you.
Mr. Mayor,
Yes.
I've got questions on this as well. Is one of them being, what effect is this going to have on the businesses? They're the ones that are taking the brunt of all this. And Mary Jo, you say that there's monies out there to reimburse them. Are those monies enough? I mean, how far does it go till the business goes under and the monies that they're going to get from the government isn't enough to even bring them back? So my theory is that life still goes on. We still have a community to run here, and we still need the businesses here to go. If you start shutting them completely down to where they can't operate, how are we supposed to survive? Those are my comments.
Thank you.
Dan, I need to clarify his question. Dan, your question is, what effect does leaving the city-county health board have on area businesses?
No, what effect is this having, the COVID period is having on these businesses? And if this health board is going to issue stricter ones than what the governor's doing, how much can they take before they all go under?
When they leave.
So now, let's open it up. Do you have a special order of who you want to speak?
No.
We're still at the council, and I still wish to speak.
Okay.
Okay, you cut me off when I wanted to speak to the subject which you introduced, which was your attempt to create scientific medical information from, as you indicated, reputable and accepted sources and journals. May I comment on that?
Okay.
Okay. The mayor has given us, as part of this deck of cards tonight,
Get a little closer to the microphone.
information collected by Mayor Clacken on COVID-19. The fallacies of what is in here is that it is similar to your 18-page, what you allege to be medical, scientific, an alleged medical scientific treatise, which was essentially medical and scientific garbage, Mr. Mayor. At this time, your more succinct 1, 2, 3, 4, 5, 6 pages is not even as transparent as your earlier attempt, which I think it's interesting to note that your earlier attempt, you have never put forth in public discussion before the city council. The first in your first attempt, you had a bibliography, which is good. Unfortunately, you didn't have any footnotes, so no one could check your use of those sources in the creation of your document. And in this instance, we don't even have the bibliography. We're supposed to just accept the fact that you have honestly summarized medical, quote, peer-reviewed medical journals and given us that summary. That's far from the truth.
Are you done?
No, I'm just pausing, Mr. Mayor. Unfortunately, I like to think every once in a while.
We do have a lot of people that want to speak.
Well, just bear with me for a moment. Obviously, you're gonna cut me off after 2 minutes, so I won't dissect the 6-page thing as much as I should be able to in a public meeting. But it is essentially hogwash. Mr. Mayor, I would ask you a question.
Okay.
After your earlier attempt with the 18-page treatise, were you contacted by any doctors in the community?
Yes, I was.
And did any of them essentially agree with your conclusions in that treatise?
I would say not, no.
Okay.
I was even made a statement to me that I am killing people.
Pardon me? I didn't understand that.
A statement was made to me that I am killing, if I get in this stuff in effect, I would be killing people. And I took offense to that.
If that was made by a member of the medical community, a doctor, unfortunately, I have to agree with that. If you follow through with your opinions and ideology, leading the city down as a Pied Piper down a path of destruction.
Thank you, Dr. Wassel.
I'm not a doctor.
I know.
Public health, medicine, cellular biology, and other disciplines which you have not.
How do you know I haven't had those college classes?
Name them.
We're not into that. We're not doing that.
No, your lack of standing in those regards is evident, Mr. Mayor.
Are they done?
Your opinion.
Are you done? Because I would like to hear other people.
If you wish to refute it, the floor is yours.
Well, let me just make 2 comments and then we'll move on. And I'm not going to refute your statement. It's hard to refute incompetence. So, the first one is my first attempt, why I just sent it to the council and I didn't send it to anywhere else, is the plan was, and it still is, it will be in front of the City County Health Board. That is what I wrote it for and that is where I'm taking it. So Monday it is released and it will be talked about. I don't know what will be stated, but it will be talked about then. That is why it never came here. It was planned on to go to the City County Health Board. The one statement that you were talking about, like you couldn't tell footnotes, wouldn't take much. If you look at the end of each sentence, that's usually where footnotes go. On the statement made, it would tell you exactly what number on the footnote and where to go look. So obviously, you don't have much experience on reading scientific journals.
You have no footnotes in that document.
I think you're blind. Because it's there.
Document, I'll bring it and
Bring it as much as you
show it
want.
on camera if you like. but there's
Now let's
no
move on. That was the 2 comments that I wanted. Let's have Mary Jo bring out who she would want to speak. Try not to make it a half hour, okay?
Thank you all for coming. Dr. Logie, could you start us on this discussion?
Can you hear me fine?
Yes.
Get a little bit closer.
Okay.
Okay, there we go.
How's that?
Good.
Yeah, this does involve businesses, but very importantly, it involves their customers, their staff, and every citizen in our community. And I'm just thinking early this morning, when you and I were sipping coffee, either at home or in our office, the COVID crisis was unfolding big time up at Bear Hospital, Emergency Room. The ER staff today had so many COVID patients, they're overtasked and overwhelmed, and they're at their maximum ability. And you don't sweep that sort of thing under the table pretending it's not there. Have you taken time, any of you, to talk to one of your constituents who's lost a family member to COVID, to find out what it was like for them or their loved one to die alone? That's not the way to be. Unless you've really examined this, you have no moral authority to try to undermine our professionals' preventive efforts. Until you walk the walk with our health professionals, our providers, who put their own lives and health at risk every single day, working hard hours, potentially bringing this home to their families, they're working to fight this disease, which has been allowed to spread because of naysayers who don't believe in masks and social distancing. Unless you've done that, you have no moral authority to assume an air of knowledge of this disease. If you get seriously ill nowadays and in the future or injured, you may not get the care at our hospital that you're used to and take for granted now because of the impact of coronavirus at our hospital. The biggest business in our community. You've stated this virus will never go away. Well, that may be true, but neither has heart disease or cancer or diabetes and all their complications. They're not going away, but we're doing everything we can to prevent those, and we have to do everything to prevent death and disability from COVID virus. We, and I, including the city council leadership, should be aggressively pursuing every reasonable method to prevent more unneeded illness and death. You need to show support for our health professionals and our public health nurses and doctors and the health board. Anything less is absolutely wrong. Thank you.
Thank you. Any other doctor wants to speak? Or nurse, I'm not sure some of the names, I'm not sure what positions they're in.
The next one would be, if we're going across the top, Mrs. Sue Hansen, our County Public Health Director, Health Department Director. Sue, do you have any comment?
Well, I'm just still trying to get my arms around what you're trying to do and what the reason is to not be a representative with the Board of Health. I guess I still don't understand it. I'm not sure what the implication of that is, but I know you still have to follow the rules of the governor. You can't like say, oh, we're not by Board of Health and we don't have to follow the governor's orders. I guess I'm just really totally confused about what this all is about. There's never been mention of closing business down from the Board of Health. I guess I'm just kind of flabbergasted, I guess.
Sue, I was having a bit of a hard time hearing you. Did you say that there has never been discussion at the City County Board of Health to shut businesses down? Was that your statement?
That is my statement.
Thank you. The next one would be our head of the emergency department and medical director, Dr. Greg Moore.
Thanks for listening. Can everybody hear me okay?
Mm-hmm.
I'm Greg Moore. I'm the medical director of the ER, is also the CMO, Chief Medical Officer at the hospital. What Dr. Logie mentioned earlier is absolutely correct. Our staff in the ER is stretched to the maximum. We're not able to provide the care that some patients need because of the constraints on the space in the emergency room and our staffing. To date, we've had 21 patients, or 21 of our employees positive for COVID. I can give you the numbers. Of that 21, all but one have gotten their COVID because we contact trace in a restaurant and/or public place like a bar. All but one. There's been no patient to employee transfer, and there's been no employee to patient transfer of COVID. That being said, this is something that's going to be with us forever. This is going to be an endemic virus, which is, endemic virus is like influenza, and each year we're going to be faced with this. And it's not how do we get rid of it, it's how do we live with it and keep the businesses open and keep our hospital personnel safe and be able to provide the citizens of Dillon and surrounding area the health care they need and they deserve. We're at our max and there is no backup for us. So I would encourage us all, rather than to kind of separate here, is to work together to achieve those goals. And I think that's the whole purpose of this, is let's all work together to achieve these goals. Because we're not going to beat this virus, we just got to learn to live with it and then continue to provide medical care as you're used to. Thanks.
Thank you. Who's the next one?
Thank you, Dr. Moore. Dr. Madney? Possibly stepped away. Dr. McIntyre?
This is John Madney. I'm just listening.
Okay. Dr. McIntyre?
Thank you. Can you hear me?
Yes.
I just want to say a couple of things. One is that as a member of this community and certainly as a provider at the hospital and at the clinic, my expectation and frankly, what I frankly need from our community is collaboration and support. That we're talking to our patients every day and our patients are looking for that from our community leadership. For myself and my family, when I walk into a business in Dillon, I am considering my protection of those employees and other people, and I'm considering how people are thinking about me. So if you're a business owner or you have business here, I'm looking to you to be doing the safe, right thing for me, my family, and my patients. That is how those businesses are going to stay open. When I walk into my clinic, I look at my patients and I expect them to wear their masks and be considerate and cognizant of the safety of my staff, myself, and the people around them. And frankly, people do that with what they want to do. So I guess I will just say that I'm really emotional tonight. It's been a long, hard day. It's been a long, hard week. I just got a phone call about a COVID positive patient from the lab that I have to now get off of this phone call and call them and tell them they're positive. And that is how our providers are living every day right now. Truly what we need from our community and our leadership is collaboration and leadership. I'm looking to you all to be thinking about how do we protect our community, how do we protect our hospital and our employees and our staff, how do we take care, how are you helping us to take care of this community? And it's simple, it's simple. Wear your mask, wash your hands, socially distance, cognizant and caring of those around you. It's simple. That is what's going to keep businesses open. That is what's going to keep us all on the job and able to take care of you. Thank you.
Thank you, Dr. McIntyre. Dr. Tipton?
She's at work.
Okay.
So who's John Pickens? I want to hear from him.
It's okay.
We're good.
Well, the last one that of people that I invited to please come and give comment, and I am very interested in hearing Dr. Pickens' comments, but I want to make sure that we get on Charlene Logie, and do you have comments, Charlene?
Why Charlene? Just get Pickens first.
She's a teacher. She's a teacher from
Is
the
he a
education.
doctor? Is Mr. Pickens a doctor?
Dr.
Yes.
Pickens, yes,
I want to hear from him.
Let's hear from the doctors first, then we'll go to Miss Shirley.
Okay.
Okay.
He
Oh, go
defers
on
to
in.
Shirley.
Oh, okay. Then go Shirley.
Shirley?
I have to say I'm a little confused, but maybe you'd like to hear from me.
Yes.
I live in the city, I frequent businesses in the city, and I think that we're part of the broader community, which includes the county and the state, and that we should be acting in concert with the broader world, rather than isolating into a small part of that unit. So it makes no sense to me that the city would pull out of the city-county accord or any other kind of processes to protect all of us.
Thank you very much. I forgot, I'm sorry, I'm forgetting one person. Karen, I've forgotten how to pronounce your last name. Karen Larch, who is new to the public health department. She's a great nurse. She gives a good shot. Karen, are you there? Would you like to give comment?
I am here. Can you hear me?
A little bit.
Oh, okay. Well, what I would like to say is I agree with Dr. McIntyre. I don't quite understand what I'm seeing. I've been in Dillon now 2 years. I have 2 homes in the city limits. I shop in Dillon. I keep my business here, and I choose to work in Dillon. The job I chose is to work for public health. I have been a nurse for 35 years. What is interesting to me, what I am seeing is such poor manners, you guys. I would like to think that I have moved to a city that is respectful of each individual. And I would like to be treated that way when I call you on the phone if you are a close contact to a case. I didn't know I was stepping into this when I took this job. I had no understanding of public health because I was a surgery nurse. I have grown to love public health, and I have grown to love Dillon. This is my first experience with a city council meeting, and I would like to see also that I could be so proud of my city council. And so I don't quite understand what I'm seeing. What I will tell you guys is that I am working 7 days a week. Sometimes I was working for no pay because I cared, and I wanted to make a difference, and I wanted to deal with what was happening with this pandemic. And sometimes it meant that I was coming in and I was calling a COVID-19 patient and trying to help them through a really hard time. People are very scared when they get this diagnosis. And sometimes I cannot just rush through it in 15 minutes. And then if they have been near 10 people, at one point in this time, there were only 3 of us on the department making calls, and I had to call 10 people and discuss their close contact with with the case. And I just want to say that I'm a little bit with Sue. I don't understand how pulling the city of Dillon out is going to help the greater good of our community. And so I think I'm more asking for respect for one another in all of the position that we're in, that none of us chose to be in. So thank you for listening.
Thank you.
Thank you. And the last person, well, Dr. Pickens, do you have a comment?
I do. One is that to all of you who think you should not wear a mask as you're sitting in that room, next time you have a surgery, ask your surgeon not to wear the mask.
Okay.
2, we are seeing spread at referral centers in Missoula because not because the patients, because our nurses and our technicians are being sick from the community not following precautions. And 3, I have had the experience of not having a bed, not having a ventilator for a gunshot victim because you're full. This is real. People are dying to their last breath on their hands and knees. They kind of prone themselves because that's the only thing we can do for them. This is going to happen to someone you know. You cannot push it away. Thank you.
Thank you, Dr. Pickens. The last person I invited to come tonight was Dr. Ed Mooney. Ed, do you have comments?
Yeah, I don't really have too much to say, except that I too don't understand not taking the advice of the professionals. It's kind of a no-brainer. If you wear the mask and everybody else wears the mask and practice the other social distancing and so forth, you can drive the probability of spreading this thing to close to 0. I was doing some modeling today and calculating probabilities and so, and it's just nonsense to not do what we can. It's probably, in my opinion, the best way to keep the businesses open and make them feel welcoming to us that really want to be in the stores more than we have been.
Thank you.
Thank you.
Thank you very much.
Okay.
Was there anybody I missed? Is Dr. Tipton back from the hospital?
No, she's not, but this is her husband. I'd like to make a statement if I could.
Yes.
My name is Bailey Tipton. I'm Dr. Tipton's son. We're raising 2 young boys, 4 and a year and a half. You know, she doesn't have a choice when to go to work. She was not on call this weekend and fielding COVID calls and calling people all day, taking time, her day off from our boys. And numerous nights she's at work late, making COVID calls. So I just ask, please do whatever we can to slow this down so that these people, the doctors, the nurses, pharmacists, even the grocery store workers, can go to work and be safe and spend time with their families. Because if she gets it, they get it, she's not going to see her boys for 2 weeks, and that'll crush all of them. So please just take all these other people into consideration. Thanks.
Thank you very much, Mr. Tipton. Have I missed anyone?
Okay, now let's open it up to the public out here, if you guys don't mind. They've been sitting patiently. Instead of grabbing that, I'm not sure if that one's on. There's 2 microphones right by the door. If you can grab them and just push the button in until it's yellow. You know, and then speak away at whoever wants to speak. There's a button in there, push it until it turns yellow, then.
Can you hear me?
There you go, if you would speak. First say your name and, sorry.
I'm a local business owner. There's many other business owners here as well. But this virus thing, it's just got that hand. I think we're kind of exposing the whole medical field in general and the incompetence that falls in the area of viruses. Can you hear me?
No.
So I think we're exposing, the incompetence of the complete medical field about the virus and what's going on. A mask is not going to slow the spread or stop the spread of the virus at all. It's complete insanity. It's all about control. There are many cures out there to get rid of this virus, but it's not about curing things, it's about keeping it going. It's about locking down the public, keeping them from, there's more people going to be hurt from being shut down, not having money, stress that comes with that. There's going to be more people get sick because that wearing the mask itself causes sickness. Look at what happened in the 1900s. We had the same thing with pandemics. They wear the face mask, more people died from that than they did of the plagues and stuff. It's known throughout history, and we're just repeating history again. and it's got to stop and it's got to end. And I think once we get rid of some of the medical professions that we have now that think they're scientists, that are actually curing and treating, and instead of treating people, cure people, we're going to have it. So if we were to have people that actually treated individuals, cure people instead of treating individuals, and have the medical profession, step aside a little bit and let individuals take care of people, I think we'd be far better off.
Thank you. Next.
Okay, we all know that I'm Patricia Biesecker. I own the truck stop south of town. I'm kind of confused by some of the statements the doctors were making. So how many actual cases do you have in bed at the hospital right now? And also you made a statement that you had your own workers come down with COVID. Something like 22 of them or whatever at the hospital. And they got their COVID from restaurants and bars. Okay, my personal opinion of that is if you have workers going out to bars, and if they're going to restaurants, are they wearing a mask? That's what you're telling us all to do. So how do they get sick? Okay, another thing I want to say is I had employees. Okay, so I had one girl 3 times be in quarantine. Do you know what that does to my staff? Do you know what that does to me? And you know why? She never was positive. I don't understand that. 3 times she had to go in quarantine because she would go out, most likely to Bozeman, knowing this employee. She was around somebody that would test positive, so she would have to go in quarantine 14 days. And you should know how this works, because apparently it's going on in your hospital right now. The other thing I want to talk about, okay, so I looked this up today on CDC website. There's 1.1 million people in Montana. To date, the records that I had today, you had 49,398 COVID cases. You had 543 deaths. What percentage is that? It's 0.0049. What are you doing to our freedoms in this state? What is the country doing for our freedoms by shutting us down? And I don't care, you can shake your head, do whatever you want, I don't care. Because these are facts that I looked up today. I don't want to hear from any of you, I'm talking. Okay, so, to further this, there is twice as likely to die of heart attacks because of COVID this year than any other year, because they lack the medical care to go to hospitals for because of COVID. They don't want to have to go to a hospital to get tested for COVID before they need what they're going in for. And this is the scare factor that you're putting into people. And it's not right. And also the stress is killing more people by heart attack. I've worked ungodly hours this last year. I have been under so much stress. If I die of anything, I'll die of a heart attack. I have been around people from New York, California, Oregon, Washington. This is within the first 7 weeks that we were shut down in a restaurant. I ran the C-store by myself. I had little kids running around from these states. I had people come in with their wives sick in their camper, but they was on vacation. But guess what? My restaurant was closed up. I'm not sick. If I did get COVID, I didn't know it. And that is what I'm hearing from the majority through the truck stop. And there's a lot of people float through that truck stop from all over the country. So I don't know what you're thinking you're gonna do, but it's not gonna happen at my truck stop. Because it's not gonna happen. You can do whatever you wanna do as a health department, as your doctors, and right now, as far as I'm concerned, if I have any medical issues, I would not go to Dillon Hospital. I would not go there. And Sue Hansen needs to lose her job. And if she doesn't, I'm gonna run for city council next year. Or the next time it comes up. Because there's been employees come in and tell me that they were told that if they go to work, and you know my employees, you know where they work. So don't give me the fact that you don't know where these employees get their COVID, where they work, who they associate with, and most of my employees did not get it at my place because they would be out partying. They're either out in the bars or they go out private parties. This is how this is spreading. So don't give me everybody needs to wear a mask. If people want to wear a mask, that's great. I have no qualms either way. You know, you come in my establishment, you wear a mask, or you don't need to wear a mask. If the mask is doing the job it's supposed to be doing, and another person is not wearing the mask, then that's his choice. That's the choice of freedom. If we are going to be a bunch of sheep and just follow what the governor wants, who is not going to be in office very long,
Thank God.
and follow Sue Hansen's directive, who wants to shut everybody down. Now I know for a fact that you need to lose your job. I would like to see that happen. I'm sure there's somebody out there that would like to take your place. Because I'm fed up with it. I'm fed up with the talk and my employees coming back to me and telling what was said. And if you guys aren't doing your job, yeah, it's part of the job. It's part of the medical field's job to check on if somebody got COVID, you want to check on who they was around. Okay, so everybody has to go on quarantine. How many people, I want to know, today is in a hospital bed with COVID? Today. Not just ones that came in and test positive. There's a lot of people testing positive.
The more you test, the more you're going to get positive.
There's a lot of people test positive, but they live through it. We're going to live through it. If we're not, we're going to die. Are we scared to death? I'm not. If I die of COVID, fine. I'll probably die of a heart attack. But, you know, come on, let's get grips on reality. We cannot live like we're living. Everybody's going to get COVID. It's just like any other flu going around, and it's going to pass.
Okay, thank you. Now, first thing, just to correct your information. Sue Hansen works for the county. So if you wanted to be her boss, you gotta run for county commissioner.
All right.
So
I will.
it's not a council, that's
Is it on?
Well,
there's the yellow button. Is it lit up? Thank you.
Okay, my name is Sarah Hartman, and I am from Dillon. I'm a business owner and a mother of school-age children. And I am wondering if you could tell us what the advantages of the city staying a member or a part of the city-county health board. My limited knowledge is based on starting to attend some of those health board meetings to be able to hear for myself, you know, what the discussion was and what topics were being brought up. My main concern is that there hasn't been a forum for questions or public input since that last meeting. And I'm just curious if it's such a vital piece to our public health, why are we not having those meetings. So again, what are the advantages of being on a part of that board? And secondly, why are we not having meetings? Thank you.
And thank you. I'm not sure, maybe we should have Sue Hansen answer these. I'm the one asking to be removed from that, so I'm probably not an unbiased person on that question.
Okay.
So maybe Sue or somebody answer to get more unbiased than I would be on that, if you don't mind. Not putting pressure on Sue, she doesn't want to answer. I control.
Well, my understanding is that Sue is just an advisor on that board. She said in one of those meetings directly to me that she's not actually like a voting member of the City County Health Board. And so my concern is that we really do need to figure out what the forum is for the public and the business owners and the medical professionals to be heard and in a professional way. Again, I'm not trying to take away from what all of you are doing. It just seems that, like we've all mentioned, we're in the middle of a crisis. And whether you look at it from an economic standpoint or from a medical standpoint, I think we have to have some infrastructure in place. And whether that means, yes, you guys remove yourselves and then, you abide by your own set of rules. I don't know if that's advantageous or not. Again, I just would really like to know from you what the advantages are of being a part of the Public Health Board.
I'm going to, especially the question on why the board has not met, I will defer to the technical advisor on the board, Sue Hansen, but from my perspective, Sarah, the very real advantage of staying with the City County Health Board is that we are relying on the information that is given to us by public health professionals and medical advisors. And when we're in a pandemic, or if we were thinking of a different public health crisis, such as there was an explosion somewhere and our drinking water was contaminated. Who do we want to get our help from on how to handle that contaminated water? Of course we want it from our public health professionals and from medical providers. I think that there are several other comments that have supported that kind of an idea, and I was especially touched by the ones that said when we're in a pandemic, it makes no sense to draw away from the broader community and isolate ourselves. It makes more sense to join the broader community and learn from all that expertise, and especially with COVID, because the learning curve goes up every day. New things are learned. And so it behooves us to stay part of that infrastructure.
So what I see happening is that it just continues to get deferred to another person or another expert. What I'm concerned about is that while the powers that be are trying to decide when the meeting might be or what the infrastructure might be to be able to solve these problems, in the meantime, public health is making recommendations. Public health is moving to do things that they see to be beneficial and in the best interest of the community. But there's no public forum to be able to reply to those things. So like when the school board was trying to put together a plan to reopen our schools, they had to go to the Board of Health and present their plan and there was an opportunity for people to have input that said, you know, this I think is good, or what about that? Today, there was a recommendation to the schools that all extracurricular activities be canceled for the remainder of 2020. I don't know. I want to be supportive of what the public health and what our health professionals are recommending, but it starts to feel like there's no way for us to actually get our questions answered or to have our feedback heard, whether or not we end up being able to have our way per se. It just feels like there's an entity out there making all the recommendations that people are just going along with. And in the meantime, there's actually no infrastructure in place then for us as business owners, as parents, as concerned citizens for, you know, all those same kinds of things to have any input. So I just would like to know from you guys how we can expect to either see you withdraw from this and get, like, you know, involved in the you know, the decision making, or to be on the board but to actually have meetings so that we can be there. Thank you.
And I agree, it has been let down. We haven't had one since August. Not sure why, it keeps getting canceled. We've had 2 scheduled and they both got canceled. I didn't cancel them. Okay, I was ready to go to both of them. And I disagree with what Mary Jo said. The City County Health Board's position is not to just blindly follow what the medical profession says. What they're supposed to do is dig through all the peer-reviewed journals, find the science, and then base their decisions on science, not what somebody believes or what they are taught to believe in another place. I feel for it. I took offense when we were called immoral. That was not a good choice of words from one of the doctors there. I believe we all try to be as moral as we can, and by putting us into that position was not a good thing to do. I lost some respect for the doctors there on the statement, and most of the stuff I heard from the doctors was just a feely good, let's get our warm feeling, and we can't handle the hospital anymore. I'm sorry for that, I am. You know, I did all this stuff trying to help, trying to dig up science and show what the science says. All this I found so far, no science has been produced to me where I'm wrong. I get told I'm wrong a lot, but I haven't seen any report from any of these people here telling me where I'm wrong. Okay?
May I comment?
Yes, please.
One of the things that I've noticed that I hear virtually nothing about is the incredible variability on the risk by age. It's phenomenal. And the family practice, as a family practitioner, kids, it's almost unheard of. 16 kids have died in the whole country, and I think it's the 4 to 14-year-old, anyway, in the small age group. The thing is that I think we've over-relied on hand washing and masks, and this is what I mean, is that some folks are vulnerable enough that when it's in the community and there is no surplus availability of hospital services today, let's say, is that for people that consider themselves vulnerable, they need to stay home. Just like the nursing home was locked down for 2 weeks after recently completely, is that we can't count on, if you can't count on having services, don't expose yourself and be disturbance. So we basically have to look and assess your own risk, but the simplest way is look at your age, and if you're over a certain age, you judge, stay home. Because that's the one thing that we all know really works. Because the one thing about the masks is a ton of them get touched 100 times every hour. And for folks that are unstable, anyway, I just got to say that, yes, masks stop droplets. They work in the hospital, they work in medical settings, because we've seen it. How many people got sick at work? I don't know many. But the point being I've tried to get this word out through, but I don't have any position of, is that if you think you're at risk, stay home, and even if you don't think you're at risk, if you're over some certain age, and I maybe am over that age myself, please stay home to save space at the hospital. So that's just what I want to put out, is that this is a phenomenally age-dependent problem.
Look at you.
And that's what I would ask people to think
My
about.
husband's mad, he's outside.
And thank you, I agree with a lot of those statements, I do.
I was hoping that Sue Hanson, could you answer the question of why there has not been a meeting in 2 months?
And even if there was a meeting, we're denied getting in there.
Can Sue hear us?
Sue,
Yeah,
could you answer the question of why there has not been a city-county health board meeting in 2 months? And why is it that people are apparently blocked from attending those meetings?
well, I'm not aware of people being blocked from attending those meetings. I'm trying to follow the social distancing rules, so that can, limit the amount of people in the jury room, but it is also available via Zoom, as well as this one will be available via Zoom on Monday. I know one of the meetings was canceled because of a big trial that was occurring, and we did not have access to the jury room, and are unable to find any other appropriate room. That's what I have.
Okay, thank you.
Thank you.
I know we probably didn't answer all your questions.
You got Dr.
Is there any
Logie wanted
other?
to say something. Dr.
Who?
Logie. Dr. Logie was trying to say
Oh, okay, sorry.
I want to clarify, I didn't call anybody in that room immoral. I said that unless you've been in the midst of this epidemic and experienced what it's like to be a healthcare provider and try to deal with the preventive aspects of your testimony tonight, you do not have the moral authority to make the judgments that you would like to make about reducing preventive services.
Okay, thank you. Is there anybody else?
Yeah, I'd like to say something.
Let's try to get somebody else. Let's come back to you if there's.
All right, let's say.
I don't want to do a microphone. I don't want to do that, but I want,
We've got to have it on record. So
We gotta hear
we need
you.
to have you on the microphone, please. It's okay. It'll be fine.
Or just stand close, but. Just-
my name is Kim.
Kim?
Kim. K-I-M.
Oh, great. And your last name?
It's not needed.
It's not.
I want to know why everybody's making decisions for us. We're adults. We don't need somebody to tell us how to live our life. I mean, I'm just having a real big hard issue with this, because who are they to make my decision for me? I mean, that's.
I don't have an answer, sorry, if you're looking at me for an answer.
I'm looking at you for an answer. I'm looking at everybody for an answer. I personally find this all BS. You know, I pay my bills. I live in my house. Who is anybody to tell me? It's very frustrating.
Okay, is there any other comments from anybody?
What time? Was
What
that
time?
health board meeting?
Oh, the City County Health Board meeting, 10:30. And I think the statement on the agenda was they're trying to limit who's up there, so they're gonna hold it on Zoom. So better make the statements kind of like you want to get on Zoom, I'm not sure there's gonna be a spot up there for you to have direct contact with the board.
Not everybody has Zoom.
Well,
Where can I find the Zoom meeting information?
call the county,
At the library.
call the county. And if you don't have Zoom, the library, they have Zoom that you can, they have computers on the internet that you can sign up and get on that.
I've got Zoom, thanks.
Oh, okay.
I'm being patient, Mr. Mayor, so let everybody else go, but don't go past me.
Okay, is there any other ones? And I haven't forgot you, Matt.
Thank you.
Can I say something, Mr. Mayor, real quick?
Sure. Oh, Mr. Giverson?
Yeah.
Yeah.
Heavy on the mister. Just watching this all play out, I think that, and I've said this several times, this is a bad time right now for everybody, business owners, physicians, nurses. I can only speak from the law enforcement standpoint, and it's extremely difficult. So I do understand the businesses and what you're going through, because I too have to figure out my employees and what my employees do, what they can't do. And so it's tough. It's tough, and I have a 24-hour, 7-day-a-week job to fill for the safety of the community. But I think what we're all maybe missing on here a little bit is every one of you guys and every person is trying to do their best. And the opinions may be different, your viewpoints may be different. You can kind of see these things boiling up, but we are one community. And I've worked with, I think almost everybody I can see there at the council. I've worked with everybody, basically I can see it on Zoom here too. And I just want to say, you guys are all really good people with really good ideas, and you want the best. And I think as people, we start pointing fingers at who's wrong and who's right. I think at the end of the day, we all have to take a deep breath and realize that our opinions differ from one another. Everybody's doing their best. It's just how they decipher what this problem is. And I think that, I'll get on my soapbox here in a minute, but I think even as we're talking about this, I've heard a lot, but I'm wondering, just as a person that works here, is we're talking about the Board of Health stuff and the concern of putting more restrictions on. That's the first thing I heard when this all started, is putting more restrictions on businesses other than what the governor has already put on. And I'm just curious, is that the intent of the Board of Health? Because I think a lot of this discussion maybe just balances on that. I don't know the answer. And so I guess I'm not on the Board of Health, so that's one question I would like to be answered, because a lot of this, I think, has been talked about, but that's the one question we haven't had answered. But I may be overstepping, but I'm just concerned for our community all around. I'm concerned for the businesses, I'm concerned for the hospital, I'm concerned for my guys and girls that work for me. It's been a rough road to hope for everybody, but we'll get through it one way or the other. I just hope it's sooner than later. So, but if that question could be answered, I think it'd bring a lot to the meeting.
Any others?
Mayor, could you answer that question?
Good question.
Chief Giverson's question. Yeah, I believe, am I stating this correctly, Chief Giverson? Where did the idea that the city-county health board would be enacting stricter mandates than those defined by the governor, where did that idea come from?
Well, it's been discussed in several meetings.
That's not what I asked. I asked if that was what the Board of Health was asking. And so I didn't say, where did it come from? I don't know where it comes from. I don't care where it came from. I'm just wondering if that's the intent of the Board of Health.
If that is, excuse me, I didn't understand the question, Chief Giverson.
Is the Board of Health going to put more restrictions? That's his question.
Is the Board of Health going to make stricter mandates than the governor's? Is that your question?
Are they going to ask to make more stricter mandates than what the governor proposed?
Yes.
And it's possible.
Okay.
It's up for the discussion in front of the City County Health Board Monday. It could make it that we will just enforce and vote exactly what he said, Or it could be that they will go more, but that will be discussed Monday.
Oh, and it's on the agenda.
Yes.
Do you know who put it on the agenda?
I believe it was Sue, wasn't it? Sue Hanson put that on the agenda?
I put in on the agenda was the governor's directive, is what I put on there. To discuss the governor's directive, which is what they're supposed to be doing and what Board of Health is supposed to be doing.
And I'm just going off of in the past, whatever they put on is discuss the governor's directive. It always turned out that we voted on making it more strict than the governor's directive.
Why?
I don't know why, that's what the vote went.
So that is really not on the agenda. The agenda item is
Would you like to know what it is?
Please, yeah, great.
It is discuss proposed COVID-19 position of city county health board.
That was me.
Okay, that's one of the items on there. Review of phase 2 executive orders.
And that's
on
the
there.
one.
Discussion of possible future changes and what it means for Beaverhead County. That's pretty specific.
I guess I didn't hear in any of that to consider making the mandates stricter.
It's an agenda item.
Which means people can speak on it just like we do here. And someone could throw something out that says, hey, I think we should do this that's different from the governor's directive, and if enough people agree with it, they vote on it. So leaving that as an open-ended type of an agenda item, it opens it up to conversation in which people are able to converse and then develop a decision and vote on it. So it could go great.
Let me explain to you, and I could be wrong, Robert's Rules of Order. I believe that when you have an agenda item to discuss the governor's directives, that's what you're allowed to do, is discuss it. It's not an action item. You're not asking to approve or to reject. You're just simply discussing the governor's directives.
And you're making an assumption, I will get to you, you're making an assumption. The last ones it's happened that they voted more, and if you had read the minutes on those, it was just discuss what the governor put out. And then it turned out they meant more strict than what the governor. It happened in the past. I don't doubt that it might happen now. Might not, but it might. So it happened in the past. You can only just go off of what's happened in the past. Might not happen this time, might happen. And
Mr.
just
Mayor.
trying to get people informed on what it goes.
Hey, Mr. Mayor, if I were you, I might just call for a point of order and have it tabled to the next meeting so that it's on the agenda as an action item, and then make sure that the people that are affected by it show up and discuss with the board what it means to them. That's how they handle that.
Yep. Feel free.
According to Robert's rule, the mayor runs the meeting. This is not a private thing for you to direct your questions to who you want to talk, who you want to listen to, and bicker back and forth. We're here to discuss whether or not we want to stay on the health board.
Right.
I appreciate all the doctors' advice. I have faith in our doctors. So the things I'm doing have nothing to do with the doctors. It has to do with the health board. And the only reason I can see to get off the health board is because, quite frankly, the health board is not giving the city of Dillon the respect. They're not giving our businesses the respect. They purposely have their meetings, as I stated before, 10 o'clock in the morning. Most business people cannot afford to close their business, hire people while they go up there. A lot of business people do not have access to Zoom or don't even like Zoom. They want to be able to up there and they want to look at their representatives. They want to be able to talk to them. They want to be able to hear them. You can't hear half the people on Zoom tonight. I could not understand. You cannot always understand Zoom. This is not a personal witch hunt to find out which doctor I like most or which mask I like most. We're here to determine what's best for the city of Dillon and the health board. And quite frankly, I don't have nothing against the health board. I think we ought to stay in the health board. But I think if the health board continues to ignore the mayor, ignore the city council, ignore the city businesses, I see no reason to stay with them. And if the city of Dillon leaves the health board, that will dismantle the Beaverhead County Health Board if you read the document stating the health board. So all these people up here who's concerned about their jobs and what we're going to do, if the city of Dillon leaves, there will be no more Beaverhead County City Health Board. It will dissolve according to the original bylaws that started. Now, Matt, I'm not going to get into that. Matt, you want to? Yeah, you want? Okay, jump up. I'm taking. I don't see anybody else.
If no one else wants to.
Why can't we hold it at a bigger venue, the convention center, so more people can be there?
Let's see if this.
Because of the social distancing. Sorry.
There's yellow on the side.
You hold it down?
Yeah.
Hold it down?
Hold it down. Just hold it down until it turns yellow.
Okay, now it's working. Let's put it up in here. Okay. Apparently, a lot of people don't know what happened 2 weeks ago when we spent 2 hours in here. And I spent an hour presenting and the council basically asked me questions for an hour. And I did not advocate getting out of the City County Health Board. I advocated a position that they don't have the authority and they have not followed rules that were incorporated into the founding document. And that the second amended bylaws do not represent what the founding document said. I still believe that there's a need for a city-county health board. But as they were founded, it was to distribute health, medicine, advice, etc. One thing that I have seen or have not seen during this pandemic is the therapeutics of people that have COVID. Everyone that I talk to says they're told to go home. If they start feeling sick, give them a call. They're not told to take baby aspirin, sugar pills, hydroxychloroquine. That's a dangerous subject, isn't it?
Zinc and vitamin C.
Anything that would be therapeutic. And so we wait to see what's going to happen. Well, we're waiting while businesses are collapsing, while people are sitting in quarantine wondering if they're going to go back to work, when shops or businesses are saying, I need somebody here to go to work because I've run out of hours. I should be working right now, by the way. I've got a Mexican going back to Mexico, and one of the biggest ranches in the county needs a piece of equipment. But I've spent a good share of today, and you know how much time I spent 2 weeks ago in the studying I've done, which I'm going to deliver a little bit more to you tonight. It takes time. This is a public service. I feel that my community needs some of this, and they need the City County Health Board. But I had an appeal. I issued this lawful appeal 4 months ago. We've had numerous meetings. We've had numerous cancellations of meetings. We've had what I called and coined the super secret meetings. And that's insulting, but it's somewhat true. Rush Schwant didn't know about it, and he's a health board member. He was rather upset 2 weeks ago. That's why I'm repeating it. It's not to put the dig in, it's to say that we all have responsibilities. Now, I'll correct the mayor. That would be the duty of the health board if they were given the authority, is to review the sciences and make their decisions based on science. But they were never issued the authority. The county didn't do it by resolution. The city didn't do it by resolution. The town of Lima didn't do it by resolution. And you're not the only ones in the book, guys. Butte Silver Bow They've got an ordinance. They created a city-county health board. They're in Montana Leagues of Cities and Towns. They've taken the city side, not the county side, so they share in your pool of money here. They created their health board in 1978. And they bestowed all the powers and duties of Title 69 in their city-county health board, which happens to regulate utilities. Their 2016 amended bylaws don't say that. They say Title 50, just like every other statutory one would. But it's the same old thing. You create an entity, you leave them to their own means, and they run off with all the advice that they get from Montana League of Cities and Towns, and nobody takes care of the ordinances. So, are they lawfully created to do what they're supposed to? Sure, if they're going to regulate utilities, that's what's in here. Missoula totally ignored my letter to the county attorney. They sent a commissioner to talk to me because the county attorney knows that they don't have the authority to do what they did. And the 3 commissioners and the mayor in Missoula County signed the same document without meeting notice. And the commissioner said, well, it's okay, we do this all the time. That's not lawful, you can't do that kind of stuff, but they're doing it. And they're forcing these shutdowns and these mandates in Missoula County, especially Missoula City proper, real hard. That's enough on that part of the subject. How do we fix this? We have the city-county health board admit that they need to revisit the founding document and ask you for permission to do what they want to do. And I would certainly put some protections and some caveats in there. I wouldn't give them the mayor's full authority. Who's watching the hen house? If I hadn't signed that document and been so forceful, they could get away with anything. They may anyway, if people don't pay attention. Everybody's been complicit in this. The hospital's been complicit in this. The hospital left our ownership in 1998, basically. They're a 501c3. They're not supposed to talk about political issues, but they have. We know they have. They're advocating positions political all the time right now. That facility cost a lot of money. It pays no taxes. I'm repeating what I said 2 weeks ago right now. The city of Dillon paid for a healthy percentage of their streets and their sewage system up there. And that came out of the sewer fund to rehabilitate the ponds that I'd set up that. It was almost $800,000. And I believe you found a little bit more, didn't you, Mr. Mayor? That was diverted out of that fund?
It's close to that.
Say $800,000. So there's a lot of things that need to be cleaned up, and everybody should know what's going on. Now, a question I have, and I've had the notice for the health board meeting on Monday, who made the determination that the public couldn't attend? Who did that? Did they hold a separate meeting? Did staff do it? Who had the authority to do that? The chairman of the health board is the chairman of the commission. Did he do it arbitrarily? Who's done this? I don't think it's even legal. Why shouldn't I be able to appear at that meeting personally? There's no reason not to. Certainly we have rules right now from the governor that says social distancing, and there's mask requirements. As far as the health implications, there was a recent study, and it's amazing that the health providers either aren't looking for this or don't want to know about it. But the Marine Corps just had a test. It was an official study last week. So we're not talking a long time ago. Researchers for the Naval Medical Research Center in Maryland and Mount Sinai Hospital in New York published a study in the New England Journal of Medicine. I think that's pretty much the proper protocol, showing how mask wearing and social isolation failed to stop the spread among U.S. Marine Corps recruits at Parris Island. Can you hear it?
Yellow still. I think your microphone.
Yeah, it's still yellow.
It's not working.
Isn't it?
Why don't you get the other one and see?
We'll go through a couple of them here.
Look at that. Lovely.
I don't need to repeat myself, do
Nope,
I?
just take off from there.
Let's put glasses on. Last week it was forehead, today it's eyeballs. Okay. Social isolation failed to stop the spread among U.S. Marine Corps recruits at Parris Island. The over 3,000 participants were divided into 2 study groups, and those who tested positive up front were removed from the group on day 1. By day 14, spread was actually greater among those in the supervised quarantine group, 2.8%, than in the control group, 1.7%. And I'm going to go over the protocols they used on this, but first of all, what that says right there is if you were socially isolated, thank you, and wearing masks, you had a 39% larger chance of being positive than negative. So the people that did nothing were 39% up on the other folks. What was the protocol for those in the quarantine group? All recruits wore double-layered cloth masks at all times, indoors and outdoors, except when sleeping or eating. Practiced social distancing of at least 6 feet. Were not allowed to leave campus. Did not have access to personal electronics and other items that might contribute to surface transmission, and routinely washed their hands. They slept in double occupancy rooms with sinks, ate in shared dining facilities, and used shared bathrooms. All recruits cleaned their rooms daily, sanitized bathrooms after each use with bleach wipes, and ate pre-plated meals in a dining hall that was cleaned with bleach after each platoon had eaten. Most instruction and exercises were conducted outdoors. All movement of recruits was supervised, and unidirectional flow was implemented with designated building entry and exit points to minimize contact among persons. All recruits, regardless of participation in the study, underwent daily temperature and symptom screening. 6 instructors who were assigned to each platoon worked in 8-hour shifts and enforced the quarantine measures. So, those people under those restrictions had a 39% higher chance of getting contaminated, COVID positive, than those that did nothing. And that was in the Marine Corps. And you know that the Marine Corps drill sergeants were on top of it. They go on to specify. If you'd like to read the article, it's by Daniel Horowitz, and it's less than a week old. And I know that there have been other reports on it because it went to the New England Center of Medicine. So we're advocating that we know something about this, and maybe we know a little bit, but we certainly don't know this, and this is pretty brand new. So we're following old protocols, if we're following anything at all, and we still are not being offered therapeutics from the very people that we empowered to give us the therapeutics. Let the executives, let the politicians run this thing here, and the healthcare officials, you do your best to do what you do best. But sometimes it helps to listen a little bit too. And I will pursue my appeal. Hopefully I don't need to. If we could just get this thing fixed, I've got a general outline. I don't want to force this down people's throats. I want it to go the way it was intended to go. If in fact the rules were codified, the requests were timely responded to, the meetings weren't held in private, there wouldn't be any reason for any of this. But that hasn't been the conduct for the last 6 months. And it's not going to get any better over the next 6 weeks, probably. And who knows what's going to happen when that transition happens. We don't know if we're going to have a worse spread, a better spread. We don't know the politics of the other side. But we know that something's probably going to change. And I'd like to see it fixed. So, I would like to be invited to the health board meeting, personally. I'll sit back and I'll be quiet until it's time for me to speak. I might just be as boisterous as I am today, or I might sit down and shut up. But the bottom line is, that's the kind of system we're supposed to have in this country and in this county. If the council decided to leave, Mr. Graham is correct. It would be really hard to fund this without the city participation. You should know what your participation is. 5 county mills is, I would say, 10 city mills. What's the value of your mill, Mike?
Around 57, wasn't it?
5,700, 5,800?
And they're around 22,000.
Okay.
a mill.
So, you guys are paying, your 5 mills is almost, let's say, 18 city mills. What percentage of that budget would it be? That's pretty good, isn't it? Not that it wasn't voted on by the people and goes for a specific purpose, which it should, but that's a lot of money. And that's why it would hurt a lot if the city left. Like I said, I don't advocate that. I think that's the worst possible remedy to this situation. But if you don't have a whole card, this is going to go on and on. And it shouldn't. I raised the budgetary questions last time. Those need to be answered. I see a couple of you definitely read those documents and understand them. And they say what they mean. And they mean what they say. That is a contract that I signed, attested by my clerk and my head of council, chair of the council. And the county and the town of Lima did the same. We should either be living with the agreement or looking at doing another agreement. Right now, that is the one in force, and no one has found an alternative. So, hopefully this gets worked out, and our businesses and our people depend on it. We all know that the pandemic is bad. Some people have no effects, others are going to die. The sooner therapeutics get to these people and can help them, which may be just advice or it might be a simple pill. May end up being a vaccine in the near future, we hope. But we can't just sit there and say it's terrible and we're working overtime. Everybody's working overtime. And I hope it goes good for our community. But we got to tackle this thing and do it correctly. I believe the mayor's put it on the table very well. I intend on going to the same places I go. Hopefully I don't have to break the governor's directive or other directives. But at a certain point, the law doesn't mean as much as your constitutional right. And it'll end up being fought in court. County attorney, I think he's got a good position on this. I mean, I've talked about this a number of times. Jed and I have been at loggerheads in the past. But his position that he's not gonna go to district court over a $25 fine is a pretty reasonable situation. You know, people should respect each other. I am not being disrespectful when I don't wear a mask. That's not my intent. I don't think that they help. If I did, I'd wear a mask. Now, there's other things that can happen. If you're sick, wearing a mask, you better be home. You shouldn't be in public. I think the mask is a pacifier and quite often does about as much good. So hopefully we can get through this. You guys got a tough decision to make. I would recommend giving the mayor authority. He's not going to go off wild. He'll give them every chance that he can. And if they won't avail themselves of the truth, then maybe it will be required to get out. Hopefully it doesn't come to that. Thank you.
Mr. Mayor?
Oh, yeah, yes.
At the conclusion of your comment period, I have a motion to make.
Okay. Is there any more comment from the public?
Let's make one more comment.
Okay.
There's a mic right here.
Oh, I think she might, yeah, turn it on. Did you get fixed with new batteries? Okay, thanks.
I guess my concern is, my name is Hank Munster. My biggest concern is we get all these cases that test positive, people exhibit no symptoms. You know, Elon Musk himself was tested 4 times, 2 times positive, 2 times negative. And I think there's a lot of fraud going on or false positives for whatever reason. But the question is how many people are actually dying of it? I mean, they're sending people home rather than treating them at the hospital. I'm sure there's therapeutics like hydrochloroquine, you can take zinc and vitamin C, and usually people are over within 24 hours. But yet that seems to be banned, and they try to use other processes to keep this pandemic going and putting Band-Aids on things rather than treating people. And so I think we need to look at the death rate. Just look at the death rate all over the U.S. It hasn't gone up. For a pandemic, you'd think the death rate would be higher, and it's not. So we got to start questioning these people that are giving us this advice that are supposedly doctors and stuff that either been brainwashed through the system or it's pseudoscience. We just need to start looking at things the way it should be looked at, cause and effect. And we got a lot of doctors that are treating people with hydrochloroquine and zinc, and they're having a 99% cure rate. So I don't know why this has to be a pandemic. I think it's more of a scare for other political reasons. And so we need to consider that as well as looking at, the problem of fear. And I'm really concerned for elderly folks if they're not getting the proper treatment on top of it when there is an answer and they're not getting that. Thank you.
Thank you. Any others? Okay, I'm going to move on. Going. Council have any other? You haven't mentioned he's going to speak.
Yeah, I don't know why I feel like Braveheart. Should have my face painted blue, but I feel like I'm about to pick a fight. I heard many of the doctors, and I'm assuming if I see their name up there, they're still on Zoom. Is that correct?
I don't know. There's sometimes people dropped off and they stayed here. I can't say that for sure.
All right, so we got
Well, one's
Dr.
there.
Pickens still
One
there,
more.
Dr. Moore, Dr. Logie, practitioner Richmond. Who's that one on the top left? Is that Maloney?
Manny.
What?
Manny.
Say again?
Madden.
Madden, okay. Many of you spoke, and I do appreciate you taking the time, and it's been quite a bit. It's been 2.5 hours almost. What did I count? 1, 2, 3, 4, 5. By a show of hands of those in attendance, how many people are business owners? Raise them high. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. 13, I make 14. So we have a lot of business owners here.
I'm a business owner.
And we have quite a few doctors here, and physician's assistants. And sorry, Rich, I got to pick on you. You made the comment earlier that the mayor is not a doctor. Well, you're right. My last name doesn't have a PhD, an MD, a DVM, or anything after it, but I do have a brain, I do have eyes, and I can read, and I can understand. I believe that there were several different things put out by the public today talking about statistics regarding this particular pandemic. I also see all of the statistics that are put out in the media, TV, newspaper, print, and frankly, I don't know which one's right. What I can say is I don't believe that I've read a single article anywhere that indicated there was a death rate greater than 1% in the state of Montana. I haven't read it. I'm not saying it doesn't exist. I'm just merely saying that I haven't seen one yet. And Mary Jo, you had somewhat quasi-answered a question earlier from the young lady back here in the far right, that kind of the responsibility of the county health board is to look at certain situations, and you used a particular metaphor, or maybe that's the wrong word, an example of something that if we had a crash or something that our city county health board would have to look at that and advise the people how to respond. I would venture to guess that our doctors that are here on this panel that are treating this pandemic in our local hospital at Barrett's Hospital, and this is a guess, so if I'm wrong, any one of you up there can correct me, but I'm going to guess that you are merely looking at an individual, taking a sample, identifying that that individual has that particular ailment, and advising them on what to do. I don't believe you're taking a test and submitting hard-found research based upon mask wearing, social distancing, where they were, where they weren't, this, that, and the other, and then providing that information to the CDC. So for us as a city to take advice from the city county health board, when I suspect the majority of the time that they're getting their information is coming from somebody that is sitting in a political seat, such as the governor. Now, he may be getting his information from the CDC, and I have seen the CDC retract certain things that they have put out over the course of this pandemic. And so I'm not 100% certain that I believe everything they're putting out. Dr. Logie, I'm going to pick on you. You made a statement earlier that if everybody would immerse themselves in the manner in which the medical profession is immersing themselves in this pandemic, they may see it differently. Well, I'm going to go out on a limb and make the statement that, again, I am speculating, but I'll bet every one of you that hold a PhD, MD, whatever after your name and are currently employed with Barrett's Hospital are probably a salaried employee. And I believe that every single one of these business owners out here are not. They rely on the products and services that they provide to the people that come into their establishment in the hopes that those people can spend money with them. And yes, maybe you guys have worked a lot more hours than you're used to. And yes, when looking at it from that perspective, you're not making as much money based upon the hour if you are indeed working more hours. But I'd be willing to bet that every one of these business owners that have had to look at one of their employees that has told them, I've got a quarantine, I'll bet that business owner has picked up that responsibility and kept the doors open in light of having staff to fill that position. I suspect that these business owners can only withstand so much of these potential or possible shutdowns, which is about to take effect on Friday, per the governor. And we may not see them stay in business. Now, yeah, in a pandemic, doctors, you aren't making any more money, but you're still making the same amount. But these folks out here that own businesses, they've lost a tremendous amount of money in revenue on a daily basis. So, do I think either side is right? No, I don't. Do I think anybody or everybody's got a right answer? No, I don't. But what I do believe is that clearer heads should prevail. And both sides needed a day like today where both sides could put forth their viewpoint and share some of the atrocities that they've seen, both in the medical field and in the business ownership field. And somehow, some way, collectively come to an understanding that we're all in this together. And we all got to figure out something to overcome this. Because I believe Dr. Moore said it perfectly. I don't think this is going to end. I think this is going to be kind of like the influenza. I think we're going to experience this year after year. I think we're going to see some years greater than other years. But I think it's going to continue on, vaccine or not. But at any rate, I hope I didn't piss a whole lot of people off, but I just want to get that out there.
Any other comments? Okay, we're moving. Rich wanted, does Mr. Pickens, or Dr. Pickens want?
That's Dr. Pickens, thank you.
Yeah, I corrected myself, I'm sorry.
Let's be clear. Make your own rules for dealing, make your own rules for the county health board. It's like making your own rules for traffic. Because your mask isn't just you. Your mask is everybody else. Your social distancing is your risk to everybody else. It's like saying you have the freedom to drive on whatever side of the road you want, whatever speed you want. Then ask me to pick up after it when you crash the car. People are dying horribly after 3 weeks in the ICU. And that's preventable if you do something simple like wear a mask. If you do something simple but not gather in a room like you all are gathered right now and spreading a virus around. People will die. And tell me what level of death it takes for you to pay attention and you care about it. And then I'll come back to you and say, please care about it. I have nothing else to say but that. It's happening right now. And that level of pandemic is flooding the hospital where I cannot take care of you when you crash your car, literally. I cannot take. We had a patient transferred from Billings to Butte for an appendicitis because they could not take care of it in Billings. This is real. This is happening. And this is preventable if you do something simple. And it's not your jurisdiction. John is right. It's not your moral authority to tell us not to do the right thing and take care of each other. God bless you. I will take care of you and show up anyway. But it breaks my heart that you're arguing about businesses. You're arguing about jurisdiction when people are dying. I'm done.
Thank you.
I think we need a group hug to get out of all this.
Now, Rich had a motion, or you wanted to make a motion?
Yes, I do. And I pray that you all listen to what has been said and vote with your hearts in addition to your minds. My motion is this. The Dillon City Council reaffirms its commitment to remain as a continuing partner with Beaverhead County on the joint City of Dillon, Beaverhead County Health Board.
Do we have a second?
I second that motion.
Okay, it's been moved and by Rich, seconded by Mary Jo. Is there any further discussion?
Mr. Mayor, I want to thank Dr. Pickens for so succinctly and brilliantly describing the present situation. I want to. You all are too young, or you didn't. George and I are probably the only old ones here, but we remembered the bad old days. The bad old days were the days when we had 1 or 2 physicians to take care of all of Beaverhead County. Those were the bad old days. We do not want to go back to the bad old days. A vote to a negative vote on this motion is saying I do not support our medical community. I do not want to collaborate with our medical community, and it is a vote of going back to the bad old days. And tomorrow morning, I will start going around Dillon, and we'll talk about the bad old days, and then we'll hear from people. So I encourage my colleagues on the City Council to vote in favor of Mr. Wassel's motion.
Now, when you implied the bad old days,
yeah,
are you implying that all the doctors are going to quit and we're going to go back to just 2 doctors?
No, I'm not. I'm implying that when you don't support and collaborate with a valued community member and partner, then there is no, I don't think that you should have any expectation for keeping that. I don't know how, it's one of those things where it took us 30 years to build what we have today. It's not going to fall apart by tomorrow, but it certainly
So you're telling me the doctors are not gonna follow their oath that they took, their sworn oath that they will help everybody?
Oh, yes, they will.
So
Yeah,
then
Dr.
what are you
Pickens
saying?
just
Then what are you saying?
I'm
You're
saying-
saying that they're not gonna help us at all now? If we get out of this thing, they're not gonna help us? Or we're gonna all go down to 2?
No, I'm saying that we need to.
What?
We could choose to be somewhere else.
That's true.
We could
Can
choose
I
to
say
be
one
somewhere
thing?
else.
Since you've opened up the floor,
Against the community, and we choose to do that with a contract saying that you are gonna help us do our job. Help us do our job.
And we never signed a contract with you.
I'm still no contract, sir.
Okay.
since you opened up the floor and I've been talked to, I know there's a motion on the floor.
Yeah, I know, but I want to address it.
Okay.
Statement that you made. And I just want to make sure I understand. You said something, and I'm paraphrasing, that if we step out of this, oh gosh, how did you say that? That we will lose the medical, the medical backing or something along those lines.
I'm trying to talk up there.
I think we're stepping back. We're retreating from our greater community, and we're isolating, and we're taking a step back.
But you make it sound, the way you presented it, at least the way I interpreted it, was that we would be stepping away from medical, knowledgeable people. I don't still have the original list, but if I recall correctly, the people that made up the board had one person from Lima, a representative, you had 2 people from the city of Dillon, and you had 3 people from the county. Correct. That was 3, 4, 5, 6, and then there was a 7th one.
I think the doctor.
Okay, so the medical individual only made up 1/7 of that board.
Yes.
What I'm saying is that you have heard this evening very eloquently from our medical community that they implore the city to remain a part of the city-county health board. For several reasons. One of which is that you are getting professional medical and pandemic advice from public health professionals. That you are, number 2, that you have a framework that has already been built, and you're not isolating. You're not taking the city into backing away from the greater community. You are engaging with the greater community in trying to find ways to prevent the virus spread and prevent death and illness and disability.
So then let me ask this question for those that have been here longer than me. How many people reside in Beaver Head County? Approximately.
Short of 10,000.
And how many people reside? How many people reside in this city? 4,500 to 5,000.
5,000. Yeah.
So I'm gonna throw an argument to you that we're the greater community in the county. We make up close to half just in the city. So for us to step out and we walk away from the greater community, I don't know that I agree with that. We're the greater community. We have more people per capita than the rest of the entire county. Maybe not total numbers, but in one little spot, we shine the brightest lights. There's more of us than the rest of Beaver Head County. So we make up the greater community in what you were just saying. So if we choose to step away, we're the bigger part of it. And I'm not advocating that we step away. I'm not. I'm just, I don't know, I was argumentative with my speech, and I'm just still on that of being argumentative, I guess.
Matt, I think that there is a infrastructure that is already there. There is a system that is in place. Mrs. Hartman gave compelling statements tonight about the need for more places and avenues for public input, and I hope that the board takes that seriously. The mayor has made compelling comments about questions that he has that have not been answered right away, and I hope that the board takes that seriously. But what I'm saying is that we have an infrastructure that is already set up. It is an infrastructure that is supported by our medical community.
But we're basing that information on our medical community. And I appreciate all of them. I appreciate all of them that are up here and on this meeting tonight. And if any one of them wants to correct what I said earlier, I don't believe any of them are actually conducting studies based upon mask wearing, social distancing, and the likes of which the governor is implementing. I believe that they are following a protocol that some of their senior people, i.e. in the CDC and other types of medical backgrounds, Walter Reed, wherever, are doing these studies. And so it comes down to an opinionated view. And I may be proven wrong that my opinion was wrong in this and all of them are right. But I could be proven right down the road that, my assessment of things, based upon certain things that I had read, I was actually right. Now, if any of those doctors up there are actually performing case studies and can prove to us and show us in their findings that indeed they have seen a reduction based upon their own study on masks, social distancing, reducing restaurants and bars to 50% and this and that and the other, I'll be more than happy to sit down and listen and keep an open mind. But I don't believe that any of those doctors are actually performing that. I believe they are going to work every day performing the responsibilities that they have signed an oath to do, and that is to treat individuals that come into that hospital. I don't think they're doing studies based on COVID-19. So the information that they are sharing with us is based upon information that they are getting from higher up hospitals and doctors who are actually conducting these studies.
Right. That they are giving you information that comes from empirical work that produces facts, data, facts, and that's how they are treating patients. So you're correct in that. They are not working off of somebody's opinion. Exactly. They are working off of science.
They're working off of science based upon someone like the CDC.
Correct.
Center for Disease Control, who just 2 months ago sent out some type of a public form that notified the general public that over 130,000 COVID-19 deaths were misdiagnosed. The individuals actually died of something other than COVID-19. Yes, they had COVID-19 when they died, but they can't for sure say that it was COVID-19 that killed them. So therein lies my problem with all of the rhetoric that continues to be put out in newspaper, print, magazine articles, what George read earlier from the Marines, from the CDC themselves. There's so many unclear answers that I sit back and go, I don't know who to believe.
I agree with you that the learning curve on this virus is straight up, and daily the CDC and the National Institutes of Health are learning new and better ways of dealing with patients and dealing with this virus. At first, they thought that wearing a mask would not help. In further studies, they learned that yes, wearing a mask does. And now We got to listen to a infectious disease specialist from the University of Alabama last week, and they are involved with the studies. And if you are in a room and you are masked and the other people in that room are masked and one of the people has COVID, you have a 70 to 80% chance of not contracting the virus by double masking. That's great information.
It is.
I want you to
It's
know
also
that-
information like Dr. Anthony Fauci, who originally came out in the general public and told everybody to wear a mask, who then later, about 4 months ago, recanted that and said that mask wearing is not good, it's actually detrimental. So
I think that I just heard Fauci today, and he advocates everybody wear a mask, and he's
So
done
now
that.
he's saying that we should wear a mask
No,
again.
he's from the very
He's
beginning.
flip-flopped
No.
now.
He
So
hasn't
it's-
even getting
it's
that.
all
Anyway, let's get off
information.
that. We're not arguing. I understand you have questions about the national and international science foundations, which provide information for practitioners. And that's great. I mean, I think you should keep questioning that and keep researching that. That's not the question here. The question here is, should the city remove itself from the city-county health board?
Actually,
You're making the thing easier.
I respect all the doctors' opinions, and I think they're probably correct in everything they've said. I don't think tonight's action by the Dillon City Council has anything to do with their medical abilities or lack thereof. What this is about a system of handling the medical recommendations that appears to be broken. This is what we're trying to figure out some way to fix. Yes, we have to maintain a safe place for all of our constituents to be in. Yes, we have to take care of one another. But we have to do it in some kind of a system that works. And this somehow we've got to fail in the system, and the system needs to be corrected. But the system is not responding to requests to improve or to hear the issues. That's what I think you're seeing here more than anything else. The system, the county health system, has got to step up and respond to the needs of the people and not just blindly bounce off going wherever they want to go, it appears. So I think allowing the mayor to have the authority to step back, if that is what is actually needed in order to shake up the county health system so that we can get something that works, and works like we think it should, that might be an option to consider. Thank you.
I just wanted to make a statement. Mary Jo makes this seem like we're trying to vote the hospitals out, the doctors out. This has nothing to do with the doctors of the hospital. Not a thing. We respect the doctors. The doctors continue doing our business, whether we have a Beaverhead County, City County Health Board or not. The only thing this vote is doing is telling the county health board, I keep calling the county health board because frankly the city has no input there. They don't listen to them, they don't invite the mayor there, they have meetings that they purposely leave the county, city vendors off and they call it something advisory committee or whatever, so they change the name, but it's still basically the county health board getting together secretly, and that has got to stop. And if by us leaving the county health board, which will dismantle the county health board completely, they will not exist for this field. It's in about the second page of the thing, what happens if any of the members leave, it dismantles the county health board. If that's what it takes to get a county health board that responds to the needs of the city of Dillon and Beaverhead County and the town of Lima, who is also a participant in this board, but the way it is right now, it's what's going on up there at the little courthouse at the end of the street. That's where everything's taking place. When everything's made, then they decide we'll have a meeting and they'll get together and they try to throw their weights around. Well, the city of Dillon, I think, number one thing which has come out of this is when they go through the makeup of the county health board, I think the city of Dillon ought to have more votes in there than the Beaverhead County because the city of Dillon and the town of Lima makes up a greater percentage of the population than the county does together. They put the greater amount of money into the thing than the county does, I believe. the city of Dillon and the town of Lima needs to have a voice that's heard. And the way it's set up right now, they are not listening to the city of Dillon at all. The city of Dillon has over half the businesses that's going to be hurt by what the county health board does. But if they talk to one of the business owners in the county, in the city of health, I don't know if we even talk to the businesses in the county. They all get together up there and they say, well, here's what we're going to do. It's kind of funny, they want to close businesses down. They let a rodeo take place here in September where there was 1,500 people, supposed to be social distancing. I've seen pictures, they weren't social distancing. And I speculate if we look at the pictures, we'll find a lot of the county health boards up there arm to arm. We got all these people, Mr. Wassel. He's talking about social distance. Not 2 months ago, he goes to a funeral with what, 100 people in there? You can't. Whoops, yeah.
Did he just, oh, okay.
No, he's good.
It needs to be done. The county needs to let the people know that the city has bite, or I don't know how to say this. You know, we have a boxer in the ring for a fight, well, I don't know how they say that metaphor, but we need to be heard. We need to be advised. We don't need to be secretly, oh, well, maybe we better get a hold of the mayor. Maybe, I mean, one of the people on the health board wasn't even aware of a couple of meetings they had. How's that saying the county health board is doing anything to help the city but taking care of themselves? And you know, if the doctors think that we're picking on them over that, we're not. It has nothing to do with the doctors. This has to do with the county health board, the city county health board. That's all this is dealing with. Mary Jo likes to bring the hospital in here and say we're picking on the poor doctors. We are not. We have great respect for the doctors. I had a doctor save my life a year and a half ago. Believe me, I trust doctors. But we cannot have the county health board up there pushing us around, telling us what to do, without at least going through the motions and making it look like they're listening to our people. We have, I don't know how many different business owners we have, and not one of them has had any good rapport with the county health board. They've all called them up and said, you're going to do this or else we're going to shut you down. I mean, that's the reports I'm getting. Now, whether they're doing it or not, I don't know.
Yes.
But I personally think we ought to give the mayor authority. If the county health board don't want to shape up and start helping the city and working with the city, I think we need to get out of it and we need to find another mechanism to do it.
Yes.
Any other comments? I was just gonna say ditto. I was gonna say.
Funny thing is, it sounded even better from you.
Yeah. Well, my opinion is that if they can't operate the board like it's supposed to be operated, then they have no business operating the board. Period. There's certain rules and bylaws that they're supposed to follow, and they evidently don't want to play the game.
And they don't follow the rules on their own.
Has the council considered all of the consequences of carrying out this proposal?
And I'll say
if without a single consequence, yeah.
And I'll say if they do the vote, I will investigate what you've said and look into the consequences. I'll have Mr. Dolan help me along with Mr. Hazelbaker. And we'll go looking through this as if you guys decide to do this. Before we do any decision on what to do, I'll make sure it's not going to hurt the city of Dillon on any options of getting government money from the state or the feds. But I will tell you right now, more of my decision will be based upon if it's going to hurt the city of Dillon, not...
Or the businesses.
Well, that's what I mean when I say city of Dillon, I'm grouping everybody. Business is a big part, but it's also the individuals too. You know, so, but I won't just get out of it if you guys decide to give me the authority to. If I do it, I will tell you exactly why and lay it all out, and you guys can, there's a little period in there, you guys can actually override my decision. Then if you find that I did totally wrong, you can say, no, we're not getting out. Because I'll put down why if I do.
I just want to throw something out real quick. If they're holding these meetings at the courthouse, we have a brand new convention center here. Why can't we hold them there so more people can go?
And it can be done, I'm not the chairman of the city
I
county health
understand, I'm
board.
throwing a
I can talk to
suggestion out.
them, I can talk to Mr. Rice, the commissioner, and find out if
Because I
he
tried
can
to go to
dig
one of
in and do
these-
that.
Because I tried to go to one of these meetings and it was full with 30 people in it. Okay, come
I
on.
understand.
So it needs to be held somewhere else that more than 30 people can show up.
We'll look into that. Now, I can't make the decision.
No,
but I will
I'm just
let
throwing
him-
out a suggestion.
Mr. Mayor, we'll call for the question.
Oh.
I have a question. You better ask it quick.
All right, so if we vote to exit today,
Well, you're not voting to exit. You're voting just to give me the authority to make a decision to either do it or not do it.
okay,
What we're looking at.
That's
though,
not
is
the
what
motion
we're
on the
also-
floor.
Right, that's not.
That's not the motion.
Well, that's true. The motion is, are you gonna continue membership?
yeah. So, but this may be even larger, and I'll be as quick as I can. If we choose to exit, and the governor's directive comes in Friday, the new one, and I don't know exactly what all it states, but I know it's mask wearing in all public areas. I think restaurants are limited to 50%, and they have to close at 10.
Correct?
If we step away from the city-county health board, and the governor passes that directive, do the police work for us and you?
That would be a question we're gonna have to ask Mr. Goldman. And he won't have an answer right now.
Right now.
I wouldn't have an answer.
Is your question that, will the police enforce the governor's mandates rather than any other direction? Any other
Yeah,
directive?
and that
That's the
probably
question.
is gonna fall on Jim to answer that at a later day. But yeah, that's where I'm going. If we choose to step away, will it protect us in some way, shape, or form as a city within the state, or does he have jurisdiction over us?
We are a system of laws, and state government trumps city.
And I would agree, state government does.
It's a
I
mandate,
still
it's
have
not a law.
I still have a
Exactly.
So at any
discussion on.
rate, it basically is gonna come down to you having to do more work, sorry.
This is a mandate, it's not a law.
The governor said that he was leaving it up to local.
Authority.
That was right from yesterday when he was on TV.
And so therefore, if it is
This is
local
my
authority, we
suggestion.
second-
Ultimately, I'm leaving it up to local authorities to what happens. So,
So isn't it the same thing that we've already had, right, that's
well,
been going
it's the
on?
same thing minus 12:30 to 10 o'clock. But we've already established that, I think, for now, we've already established that we're probably never gonna see a 2 o'clock bar closing time again, which, you know, realistically, hell, I'll be honest with you, it's not a bad deal. The old saying, nothing good happens after midnight is really true, and I know it's easier on you.
Okay, but continue.
And your question about, will they enforce, yes, they will.
But we're taking
They-
away
they do.
churches too, so you can
No,
only
what I'm
have.
saying is that, well, you don't, there aren't many churches open at midnight.
No,
All
no,
I'm
no,
saying
no,
is-
you can only have so many people at church.
Oh,
You know.
yeah, I agree, but, I have the luxury, okay, in my business, I have the luxury of owning a couple buildings, so I can spread people out. There's people that don't.
Right.
So it hurts. Half is a bad deal. Well, when we, okay, I don't know, most of you know, last year, we went from having a fire that kept us down for 2 months. We went to, right after that, we just got open, and we got shut down from COVID. By the time we got done, so here we are, we're trying to get our business cleaned up while we're putting out as many to-go meals as we could. And the very day that they allowed us to open up at 50%, we had $400 left in our account. That's how close that was. And that was only because the front of my building looks the way it does right now, because we have to now come up with the money to fix that, because thank God for the fire. You know, that's exactly how that went. And it's, you know, we're talking here about people trying to stay in business. I've been at it for 22 years. You really don't get to pay yourself. The only time you're gonna get is when you get out of it. You get out of it, and hopefully you get your money back. Maybe you will, maybe you won't. You hopefully build up enough business. You know, I'd love nothing more than to just cater everybody's kids' weddings and hire all your kids, and you know, and have them learn to work, which is really something that people don't teach their kids anymore. It's crazy how many kids come in and they have no idea.
Let me ask you this. Okay, if it goes to 50%,
It's gonna be hard as hell.
don't do it. Stay open. Go 100%.
We'll start a class action lawsuit. Well, I get
Yes,
together.
I already got a hold of an attorney.
Oh, it's.
I'll give you.
Okay, that's a whole other
If I may,
I'm not.
to Jerry's point,
I'm not gonna do it.
Huh?
to Jerry's point, we're smaller. We have 70 chairs. We've got 10 employees. Those 10 employees have families. They deserve a paycheck. At 50% of occupancy, folks, the math doesn't work. We have $8,200 in real estate taxes this year alone. We've been shut down. How are we going to pay them? We've got utilities, we've got mortgage, we've got insurance, we've got what everybody else has.
Do you still have to pay your business license if you're shut down?
Oh, you know we do.
Yep.
So that's wrong.
We have not had one proven case. 5 bars in, and I'm sorry if I'm going off on a rant, just
go for it.
5 bars in Flathead County. The health board filed suit against them. District court threw it out. Not one case was proven to come out of a restaurant, bar, or casino. Why are we being singled out?
Exactly.
You can still go to the YMCA and lift weights.
You can go to Town Pump after 10 o'clock and go buy beer. What's the difference?
I don't want to see Dylan look like Bannock. And we're fighting, I'm sorry, we're fighting like hell, just like Jerry, to stay in business. We're getting as creative as we can get. But we can't afford to lose any more businesses in this town.
Understood.
Thank you.
Thank you. Now let's go back on. Is there any others? Okay, Rich has a comment.
Yeah, I've been trying for quite a while. I got muted. To respond to Mr. Kenworthy.
Okay.
May I?
Sure. Yeah.
And I will not take nearly as much time. Mr. Kenworthy, if I may, I'd like to address 2 of your points. Number 1, well, actually it was the second point. You were expressing some frustration at all of the conflicting information and being able to handle that with the medical community, and in this setting, on the city council, being able to do that. I assume you have a doctor.
No.
And, pardon me?
No. I mentioned that earlier when I started talking. I don't have a PhD, an MD, a DBM, anything after my name.
No,
but I got a brain.
You go see
You
it.
misunderstood
A
me.
primary care
I said,
physician.
I assume you have a doctor.
No, don't have that either.
Ditto.
Well then, someone that does. My doctor puts up with me in many senses. But if I were to try to play doctor and go into him essentially with the proposition that I pay him for his expertise and I trust that he will give me the care that I require, and that if that is not what takes place, I always have the ability to go to another doctor. But in doing that, there's a trust there. I trust him. I trust his expertise. I trust his education. I trust his knowledge. I trust his ability to think and put that knowledge to work in terms of handling my care. In that contract with that doctor, he assumes that that's the position that I take with him. He does not want to be in a position of having every single decision or whatever questioned by me as to, well, why did you decide that, or how did you decide that, or what citation can I look up to decide whether or not you were right. There's a contract there that's a contract that everybody has with their doctor, that they trust them to do that. We have a social contract to go back to Dr. I'm going to butcher his name, but I believe it was Pickens. We have a social contract also with our medical community. They can't all be in this room. They can't all be on Zoom. They can't answer every drill down speculation or question that we have on COVID or anything else for that matter. And that's one reason why we have the joint public health board with the county. Your first point I'd like to address also, and Dr. Pickens was addressing it also. And this is a very hard thing to say, but doctors and staff at Barrett are human beings, just like all the rest of us. And especially if they're one of the 4 personality groups, the D group like me, they get reinforced a lot by people saying, well, you did a great job, or, you know, you deserve a pat on the back for whatever. They feed off of that. And if they sense that this community is no longer committed to the excellence that they have established and the commitment that they've established, not only in the care that we've been given as far as the virus and the pressures that's putting on that, but everything else. If they sense that that contract has been broken, they can go elsewhere. And we have, trust me on this, as a patient, I've been to Mayo, I've been to Stanford, I've been to UCSF, I've been to other larger facilities by far than what we have. And we are blessed with one, an emergency department that I believe is world class. What Dr. Moore has done up there with what he has to work with as far as resources and establishing that staff and level of care is nothing short of a blessing. And if this council takes the position that they no longer wish to be a part of the public health system with the county, it will be a slap in the face to that community up there at Barrett. And you will see, take my word for it, you will see people leave. I hope it's not Dr. Moore. I hope it's not Dr. Pickens. I hope I'm wrong. But that's what you're risking. And you're risking it because, to take your situation, Mr. Kenworthy, I assume you still work with Brad up at the towing outfit?
No, I do not.
You don't?
No.
Okay. Well, wherever you work, if your boss became, if things changed and your boss was no longer what you thought you had as far as a relationship with him, let's say he became abusive, you would go elsewhere, would you?
Would depend on the level and the attempt of abuse that that individual would choose to take with me before I left.
Okay, but let's assume they crossed that line, you would leave. And it's no different with this community that we have supporting us. In terms of not just medicine and medical community, but public health. If what has been said, if I was in Mr. Hanson's shoes, and what was said about me in this meeting tonight, I would say to myself, gee, public health people are like hen's teeth around the country right now. You can't find them. I'd be considering whether or not I'm appreciated in this community, much less this room. So that's what I would ask you, Mr. Kenworthy, to consider when you vote in terms of what the effect could be on the excellence that we have in our medical community, Barrett, the ER, doctors in general. Thank goodness Dr. Logie's not up there right now and he's retired. You can see changes because they're human beings.
So if you'll allow me to retort, and I appreciate all that you said, I really do. I look at the medical community as a community that continues to expound that they practice medicine. Their objective is to treat individuals, heal individuals, fix individuals, and save lives. You know what I find interesting about this COVID-19, and I hope you weren't referring to me saying anything negative about Sue Hanson, because I don't believe I did, but I will lump her into this next comment. Sue Hanson should have in her records that I, Jason Matthew Kenworthy, have been exposed to 6 different people that have tested positive for COVID-19. One of which I lived with my wife. I will not give you the names of the others, but Sue knows them. why is it that our medical community hasn't somebody stepped up and went, whoa, we have an individual in our community that has been exposed to 6 different people that have been positively identified as having COVID-19, and you know, my phone hasn't rung yet. There hasn't been a single blood test done on me. There hasn't been any type of inquiry about anything. Yet, I've been exposed 6 times. That kind of makes me question the medical field. Sorry, it does.
What did you want the medical field to do, Matt?
Maybe look and see if there's something in my body that could potentially help put an end to a pandemic. You don't think that's a possibility? I mean, they're looking for people that have had it and have survived it and wanting them to give plasma, but wouldn't it be in the best interest of humanity to contact people that have been exposed to so many people and not contracted it at all?
Great question.
And the
You know, but as
answer
you
is-
said before,
is-
our medical community is providing services to people. It is not doing research.
That's
Okay,
problematic.
the answer, Matt, is Sue Hansen. She has very few tools as a public health director to use. One of them is contact tracing.
Sue Hansen has a computer and talks to every single individual that contracts the disease from Barrett Hospital. I can tell you, first and foremost, Phil, Rich,
Let's stop.
stop talking.
This is,
You're being argumentative. The fact of the matter is, Sue Hansen knows that I have been exposed to at least 6 people because I know all 6 of those people are close personal friends of mine, and they all gave her my name that I was exposed to. And according to one of them, I don't know if this is true, but one individual said, well, we're not worried about him, he didn't get it before. So whether that's a true statement or not, I don't know. But it certainly seems that if this pandemic is as severe as it is, and you've got somebody that's been exposed this many times and hasn't gotten it, maybe you should do some testing. It's practicing medicine.
Okay, hold on.
Okay,
We're
let's go.
going off topic here.
Let's go,
Finish.
a question's been called for when the question's
Yes.
asked, let's go to the vote.
Okay, let's get clear what we're voting for. And
What you're voting on is
Okay.
to continue the membership in the City County Health Board. Is that what
I'd
you're?
ask that the motion be read in exact as it was made.
State it what you think it was.
I'll restate the motion, would that be acceptable?
That'd be acceptable unless I don't think it is.
The motion is, the Dillon City Council reaffirms its commitment to remain as a continuing partner with Beaverhead County on the joint City of Dillon, Beaverhead County Health Board.
And that's the motion.
Okay, by voting yes to the motion, we stay in. By voting no to the motion, we leave.
Well, and that's where it's a gray area. And that's where, if you guys voted no, majority voted no, we will go to another motion to say,
Okay.
will you give me the power? If you will not give me the power, we will vote it or sign it right then, because you will have just signed that you will remove yourself if you vote no. Otherwise, I will hope you make a motion to say yes after that, to give me the power to make a decision. Because the way the motion's made, if you vote no, the only opposite, I mean, there's only two ways to go, yes or no. Yes means you don't, you're in, we're done.
Well,
No means you're out, so make another motion to amend the last motion, if that.
can I make a motion to amend that motion?
That's correct.
Okay. Thank you, because I was kind of confused. I would move to authorize the mayor to remove the city from the city-county health board if he deems it necessary. Under the thing that he reports back to the council, either the next council meeting or by special meeting, with us to vote to
There's
approve
already a
his
motion
motion.
There's a motion on the floor.
This is amending the
And he's
motion.
amending that motion.
And we have to vote to allow you to amend.
Okay, that's fine, that's fine.
Well, you make a motion to amend. If I get a second, you go into that discussion.
We can just do it all the hard way.
Okay, we'll do it the hard way.
Vote on
We've been here 20 hours. We're gonna go vote. Vote. I'm not gonna repeat it. You guys know what you're voting on. It's
So
to
we're
remain
leaving or
in-
not leaving?
It's to remain, this vote, if they vote yes, you're gonna remain in the city county health board.
Oh, hell no.
That's my vote. Okay, all those in favor say yes, or aye, say aye.
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 And that was Rich, right?
Three.
I heard Rich, I heard Russ, and Mary Jo, correct?
Is Russ up there?
We'll say no.
Yeah, Russ is up.
Yeah.
I thought I heard Russ say yes, is that correct? Or aye?
Yes.
Okay. Russ is.
Making sure. Russ, Mary Jo, Rich. And then all those opposed to it, say nay.
Nay.
And I take it that's Dawn, Matt, Raymond, Dan, and I did Bill say nay? Okay. So that's 5, so now we're not in it. Now, is there a motion at this point to maybe just make it so you give me the power to, I like how you stated, I'm trying to remember exactly how
I
you stated.
move that we give the mayor the power to remove the city from the city-county health board under the understanding that he will contact the council either the next meeting or within the 30 days that we have to give the written notice for the city council to approve or deny his decision.
Second. It's been moved by Raymond, seconded by Dan. Any further discussion on that?
I believe that we are relinquishing our duties as a city council. Because the mayor is in a little power struggle, with the other members of the city county health board.
Oh my God. Be quiet, please.
That we are relinquishing our responsibilities and we are taking a step back to the bad old days. And Baird Hospital and Healthcare employs 259 direct full-time jobs with an annual contribution to Beaverhead County of $21 million. I believe that their voice is loud and clear. They would like the city to remain a part of the city-county health board. And I think that the people of Dillon will know about this, yeah.
Okay, now just so everybody's knowledgeable, you've just voted us out of it. So if you vote, and this is to give me the authority, if you vote no and it all passes, I will sign the document tomorrow, we're out of it. So unless you don't want to get out of it and give me the chance to try to keep us in it, we're out of it. Okay? Just so you all know.
I don't understand.
Was, Mr. Mayor,
It's what?
you are misstating what my motion was.
We've already voted your motion null and void.
Your motion is done.
You're misstating what it was.
Right, your motion was to stay in there.
No, my motion was to reaffirm our commitment to remain as a continuing partner.
So what we're doing is we're not reaffirming it, which means you're getting out of it.
No, those are not mutually exclusive.
Okay, then, it's not, okay, if you vote.
Partner if you chose to not reaffirm that we're a partner, as you just did.
Which means we're not partners.
That does not also logically mean that we're out of it.
If I affirm or reaffirm that you're not my partner, you're not my partner.
Yeah.
No, that's not how it works, Mr. Mayor.
Yes,
That's not
Mr. Lawyer.
Well.
Okay, we got a motion, it won't happen. If it fails, then we're back to dates, table one if you want.
All right. Can you repeat that? Because it was fuzzy and people were talking.
Motion to give the mayor authority to decide whether or not to remain in the city county health board. Is that close to least?
Except, right.
I don't like that.
He has to come back to us and get, if he decides, if he goes to the meeting on Monday and they do something and he says, go to hell, I want out of here, he comes to us and he says, here's the reason. I said, no. We can either reject that reason and go back in there, or we can accept that reason and go out. We have the final say on whether or not we stay or leave the health board, but the mayor needs this authority to negotiate properly.
I think we need more answers to questions. For instance, George, you had mentioned that there is a mill levy that pays that board. Money goes into it. If the city comes out of that board and it dissolves that, what happens to that mill levy?
It stops.
So that immediately begins to stop from all the county citizens, and they no longer pay that? So that's,
No, the city, how about the county still would?
if our departure dissolves that entirely,
Then it's.
Then you start all over.
Yep.
so that's where I'm like, I don't like the way it's worded, that if we vote on this, it gives him the power to remove us from it based upon his next meeting with them.
Right.
I believe we need it to be worded in a manner so that the mayor can get with the city attorney, who can also get with the county attorney, to find out if we leave and it dissolves it, what happens to that mill levy? Because I don't want to see us in a situation where somebody within the county chooses to come to sue the city because monies are still being taken out in taxes, and there's no accounting for that money.
It's provided for in the founding document.
It's right here.
But that's the original founding document, and haven't those documents been changed 2 or 3 times?
No. The
The
documents.
bylaws have been changed. The founding document is
Okay.
the original.
And it clearly states that if we step out, the mill levy immediately stops?
The government body given whatever, 90 days notice in writing, the termination shall be effective for the next fiscal year. Because the taxes already come out this year, you can't take the taxes back.
That's right.
Okay.
Or in which case termination may be effected at the end of 90 days, period, which that's another option they can do. And at that time, in the event the city council health board is dissolved, this money shall be distributed upon equal basis to each unit of government. So the money will come back to the city of Dillon, the county will get their money, and the town of Lima will get their money. If it's dissolved before the fiscal year. But in this case, actually, it will stay intact until.
Is our city attorney affirming that all of those things will happen? That that's the way it's gonna work? That the state law doesn't trump any of
I'm not
that?
going to affirm something I haven't
Yeah.
had adequate chance to research. That's not right.
And he'll research it before I do anything.
Once again, the council has the right to override.
Then why do we have even the vote?
Because we have a chance to walk out if we need to. Once again, it's a broken system, let's try to fix it.
This isn't a vote to fix it, this is a vote to,
This is a way to force repair the system.
This is a way to show my, at the next meeting.
you know, the city county health board has chosen to listen to and to follow the advice of the public health person and the medical doctor who sit on that board. And I know that the mayor is unhappy with those decisions, but that's what they've chosen to do.
This is not about the medical advice we receive. This is about the system that's applying it. That's what you're not understanding, Mary Jo. It isn't about the
I
medical.
got
Medical stuff's
it.
right.
It's either my way or the highway.
No.
That's what the city
Russ
says.
is trying to say something.
It's Russ's turn.
Mr.
Hey,
Mayor,
thanks. It's gonna take up 2 frickin' hours of all your time as well. Y'all know me better than that. So I understand this dilemma and everything you've all been talking about, but when we look at this contract, nothing goes into effect, folks, till 90 days. So whatever happens Monday, you got 90 days to deal with it. So think about that. That's the contract. So that if you remove yourself, you have 90 days in writing. And that's page 1, line item 1D, as in doggone it. I think you don't jump in the gun, but you still have to follow whatever happens Monday for 90 days. I'm not a lawyer or an attorney, but that's how this was written.
That's true.
Stace?
We need to add time to the Zoom meeting because we've only got 15 minutes left for 1, and for 2, with the talking in the audience, we're not going to have a clear recording. That all that'll pick up is the chatter in the background. So do you want to finish the voting and then give me a minute to add time to the Zoom meeting, please?
Okay, we're done discussing.
Call for the question.
Questions been called for. All those in favor of the motion say aye.
Aye.
All those opposed say nay.
Nay.
Hey,
Okay, I'm taking it, I'm just gonna state, because it's harder on Zoom, but I take it Russ said nay, Rich said nay, Mary Jo said nay. Is that correct?
Correct.
Yes.
correct.
And then I'm saying the affirmatives was Bill, Dan, Raymond, Matt, and Don. Is that correct?
Yes.
Okay, so we'll go, I will present to you guys before I do any signing what I recommend to do at the next meeting. Hopefully I'll have everything figured out by then. I'll try to get with Mr. Dolan, we'll try to get all those answers done before we decide to do anything at that point. So.
Mr. Mayor, considering the time and what we've invested, I'd like to move for a continuance. We'll pick up the remainder of the meeting at a later date.
Second.
And let people calm down.
Okay, yeah, none of the rest of the stuff is, I mean, we can talk December 2nd on the rest. Is that okay with everybody?
It's okay with me. Yep.
Okay.
Second motion.
That's been seconded by Bill, but thank you. So all those in favor of the joining?
Well, are we just gonna move to adjourn? Or move to go table everything until the next meeting and go to item F?
We gotta go to F.
True, good point.
We
Good
gotta
catch.
go to F.
We're gonna, the motion's gonna be is to table everything except item F, which is what we'll jump if it passes. So the rest of the stuff will be tabled until then. We'll pick up till that's the next meeting. Is there a second to that table?
Second.
Second.
Okay, it's been moved and seconded. Any discussion on it? That's right, it's a table, no discussion. So all those in favor of tabling everything up to item F, say aye.
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 All those opposed, say nay. I take that as unanimous for the table. Item F, public comment on items not of significant interest, but not on the agenda of public interest, not on the agenda within the jurisdiction of the city. Hey, it's 10:30.
And so what that means is you can't speak anything of what was on the agenda. So you've already had your moment to speak on what you were all
But I
here for.
didn't get to say everything.
You have something that's not on the agenda, please feel free to speak.
Let's come back to the next meeting.
That'd be great.
Anybody has anything else?
I move to adjourn.
Second.
It's been moved and seconded to adjourn. All those in favor, say aye.
Aye.
All those opposed, say nay. I take that as unanimous to adjourn.
Adjourn.
Wow.
What do you want?
Not adjourn.